Good morning, good afternoon, and good evening. Welcome to our Workplace Wellbeing and Mental Health Summit. It's so lovely to be here with you today. I'm Malvika Jetmalani, dialing in from Chicago. I'm the founder of Atvis Group, and today is day one of our summit, and it's all about breaking the silence. And so today's topic that we're going to dive into and kick off the summit with is the state of workplace mental health in 2025, addressing the growing challenges of stress, burnout, and disengagement. How very timely given everything that's going on in the world around us. Now, we would love to know where you're connecting from, so please let us know in the comments. And while you do that, I want to say a big thank you to Jessa and the rest of the Hacking HR team backstage, doing all of the heavy lifting to bring us this incredible content and programming. We have a great discussion planned for you today. So Jessa, if you wouldn't mind, please bring our panelists onto the screen. Welcome panelists. Before we dive into our topic, let's introduce our panelists. So we will go clockwise as you appear on my screen, starting with you, Mel.
Hello, everyone. I am excited to be here today. My name is Mel Goodrich. I am principal for Light and Ignite Coaching, but I'm also the vice president of Total Rewards and Wellbeing for Birdsong Health Literacy Center of Excellence. And so it's a privilege to be here with you today. I have a long career in human resources, but much of that has been in healthcare human resources. So this topic is near and dear to our hearts, specifically about how we help our employees, but also our patients. So it's great to be here.
Okay. Good afternoon, everybody. How we doing? My name is Odafe Michael, and I currently am the head of HR for Descasio, a technology company here in Africa. Precisely, I am in Nigeria, and I'm also a transformative coach, and I work with over 150 organizations in Africa. And this is one of the most important issues currently in Africa. It's something that we are literally at that curve where we have to have very in-depth conversations, because our workforce, a lot of people are dying and leaving organizations, and research has traced it to this reason. So, I mean, absolutely great to be here, and it's a pleasure to be speaking with these wonderful people. Thank you.
I can go next. I'm Dahlia Turner. I'm the Chief People Officer at RakeTech. I am Canadian originally, but I live in Portugal, so I'm dialing in today from Lisbon. Having worked for startups and multinational, I have seen this topic show up in a bunch of different ways in different environments. So I'm very excited to talk about it today.
Good morning, everyone. I'm DJ Campbell. I currently serve as the Chief HR Officer for Sanford Health, so located in the States in the Midwest. So like Mel, I bring a little bit of a healthcare background to this topic. Well-being and mental health is one of my passions, so excited to be with the group to talk about it and kick off this summer.
And last but not least, I'm Jeff Jacobs. I've spent the last 25 years in technology in Silicon Valley, working for companies like Adobe, Intuit, and Juniper Networks. My focus over the last 10 years has been executive teams coaching on things like organizational effectiveness and team effectiveness. So great to be with everybody today.
Wonderful. Welcome, panelists. I can already tell this is going to be a great discussion. So let's dive right in. We're not going to waste any time. I'm going to start with Dahlia. I'm going to start with you first. I would love to know from your perspective, is tackling stress and burnout a policy question or a culture question or something else? So we'll start with Dahlia, and then others, please unmute and chime in as you'd like.
Yeah, I'll definitely love to know what other people feel. I think there's a little bit of everything in that. I kind of think this is one of those chicken and an egg, which comes first. I think that there are definitely company cultures which will drive, increased stress, increased burnout. Thinking about, startups, early stage, when a lot is going on, where everyone's doing everything they can to make sure, that revenue comes in and the company is successful. I think there's a culture that comes along with that. Having said that, I think that policies can be really helpful in educating managers and in trying to set the tone and set an expectation about the types of things that companies can do in order to help address it, whether it's leave policies or workload policies. I think it's a good way and a good tool for us to have to be able to think about how can we address it. But I'd love to know what others on the panel think.
So this is Mel. I think you nailed it when you said it's kind of, a dual issue. But I think beyond the culture of a work environment, it's also a systemic culture outside of the work environment. It's really a culture across the United States and other countries, and just the stigmatism that's associated with mental health, with burnout, with stress, and how people feel like they should be able to handle everything. And that's just not real. And so we not only have a responsibility to address it within our organizations, because outside of our organizations, people aren't necessarily having a culture of support when they go home. And so I do agree with you. I think there's policies. I think it's more handbooks and process and support mechanisms across your business models and your organization that can help to educate and inform so that we can change the dynamic and the stereotypes that are associated with, having stress and having burnout and getting help and support.
Completely agree with what you're sharing, Mel, and what Dahlia kicked us off with. One of the things I wanted to add is that while I do think it's a policy and culture question, I've also seen a lot of us, myself included, kind of fall prey to learned helplessness, meaning that we point to things the company's not doing or my manager's not doing as an excuse for me not to take action. And I've seen very successful leaders create microcultures amidst more challenging cultures to insulate their team and create the safety and the kind of conversations that they would like to have.
Thank you so much. I think I like to align so much with Dahlia. So here in Africa, I think mental health it's a new conversation. It's quite at its conception stage. So we are literally not we literally started paying attention to it, and somehow a lot of it is more of a culture problem at the moment than even a policy problem here in Africa, because we haven't moved to the point where we have to probably engage it as a policy. So it's a culture problem. We didn't totally know or understand what it was. It was tagged as underperformance. So we didn't even have an idea that was what the problem was. But I think a lot of organizations are beginning to move into the direction of getting it into their policy so that it could, make it better. And somehow I think a lot of research is going in, and we can actually see that for those who are paying attention to it, it's reflecting in terms of their productivity. Yeah. Thank you.
So I want to touch on a point that Jeff made. You talked a little bit briefly about microcultures that some leaders create. So according to Gartner, 75% of HR leaders report that managers are overwhelmed with the expanding scope of their responsibilities. And 70% of HR leaders believe that current leaders and managers are not adequately equipped to develop mid-level leaders. So in a world where our managers are overwhelmed, how can we best build leader and manager capabilities and help them in identifying and addressing the signs of stress, burnout, and engagement.
How much time do we have for this one?
And can you solve world hunger while you're at it?
Absolutely, not a problem, not a problem. You know, I would love for there to be a inspiring and revolutionary answer to this, but I actually go back to Daniel Goleman's work around emotional intelligence. And if you look at the first stage, the first thing that Goleman talks about, it's the concept of awareness. Now, the challenge we have is that because that we're all experiencing this, it's not like I am the manager who is not burned out myself and I have to help my burned out employees. No, I'm struggling with these things as well. But beginning with my own self-awareness about what is normal. You know, we used to pass people in the hallway and say, "How are you?" And the superficial answer was fine. And then we'd pass people in the hallway and say, "How are you?" And now the standard answer is busy. You know, I mean, I think we've set a new normal. It's not busy. This is our new normal. And for me, it starts the capability that we want to build is starting with self-awareness. It's starting with what's happening with me so that I can recognize the signs of what's happening with the people around us. Now, part of the challenge with that, as you articulated, is that we are spending our time bouncing between the past and the future. Now, that's a funny thing to say, but we focus a lot on revisiting things that have occurred in the past in our business world and planning for things and worrying for things in the future, and we are seldom in the present. Multitasking is just a reality that takes place, people doing email and meetings and things of that nature, but being mindful of the present moment and being attentive to what's going on with my employees and then looking for those signs. So for instance, do we see enhanced gossip, passive aggressive behavior, people on their technology while we're in conversations and having meetings? What are people's receptivity to change and new ideas? Are they initially defensive or are they receptive to feedback? I mean, these are all signs that we are struggling with that awareness and dealing with that burnout that we're talking about. So in short, I think it starts with ourselves, self-awareness, and then the awareness of the people around us.
Yeah, I'll build on that. I think Jeff's comments were right on the money. I really would start with that self-awareness piece of it. I think when you talk about leaders, I think they're our number one defense when it comes to burnout, disengagement, stress for our employees. And I like Jeff mentioned, I think role modeling those behaviors is the number one action a leader can take. I think once you begin and you understand and you have got that self-awareness and you can ask the hard questions of yourself, you can then have those conversations with your team and begin to have those hard conversations with them where you create a safe space using that emotional intelligence to help bring out what's going on in their lives, not only in the workplace, but at home, and then be able to help not necessarily solve any problems, but maybe help them craft some solutions. I don't think as leaders, we need to go into those conversations trying to solve the problem, but rather coaching them so that they can come up with solutions that work for them.
I'd like to add one thing that Mel brought up. Mel talked about the culture that is beyond the company and how in many cultures there is that stigma that comes with talking about mental health. And I think that there is a role to be played with managers about not only making them aware of themselves, but making them and giving them the tools on how to have that conversation about a topic that many people are uncomfortable having that topic around. So it becomes almost a courageous conversation to be saying, I think you might be struggling. I think you might be needing help. I'm noticing some of these signs, and our ability to help them to make that a conversation that's okay to have in the workplace and within their team.
Great, and I'm reading the comments here as well from our participants. And Jackie says, encourage leaders to model behaviors like not sending emails after hours, taking PTO, sharing their own self-care routine. Kathy Eastwood agrees, self-awareness by leaders is critical. And then we have another anonymous user who says, just asking people, how are you? can be simple and important. So, as we look at the data around burnout, recently there's been some research that shows that, according to some stats, up to 79% of employees in the workforce are burning out. So, I want to know, Mel, we'll start with you on this one. I want to know what, according to you, are some new and innovative ways to bring awareness to stress and burnout? And second part to the question, what is HR's role in supporting mental health and well-being of employees and their dependents?
So I think that we're at a stage where we have to focus not just on mental health literacy, but also health literacy and what we're doing specifically to help our employees to be more aware. Mental health literacy is about having access to information. It's about understanding what is mental health, what's a mental disorder, what is a mental, distress. There's all the different languages, and the words are important, and understanding what that means. And so having access to trusted information. As HR professionals, we have invested in what in the United States we call EAP, or employee assistance programs. And those have a stereotype that's associated with them where people don't want to call to get help. And so we have to acknowledge that and not just keep investing in the same thing and expecting a different result. So when I was the chief people officer at Centera Health, we partnered with a company called EdLogix to be able to bring health literacy forward. It's one of the reasons I joined Birdsong's Health Literacy Center of Excellence, which is a nonprofit, because I know how important it was to our team and how many people took advantage of that. And I think we just really have to think about innovative ways we can bring information, trusted information to our employees. We do it well with financial literacy. As an HR team, we talk to them about 401ks and 403bs and all the investments and how and why that's important. We have to start talking more about health literacy. The World Health Organization said health literacy is, and I'm going to quote it here, health literacy is stronger predictor of individual health statistics than income, employment status, educational level, and even racial and ethnic group. So we have to acknowledge the importance of information that's going to allow people to stop the stigmatism and stop saying, you can't, you won't, you're not enough, you're not good enough, and understand what they need and the information that's available to them. So I think as HR, we have to really lean into this new area of health literacy as much as we're leaning into financial literacy.
Mel, you introduced a word I really want to reinforce, and I'm so glad you used the word, and that's stigma, because we are frequently talking about this as though mental health is binary, that you are either mentally healthy or you are mentally ill. And we are all, and I hate to use the word spectrum, but we are all on a spectrum. We are all in different frames of mental health, just like physical health. So having this conversation agnostic of a label, I think, is critical.
I really couldn't agree more with what Mel and Jeff have brought up, and I'm taking up on the health literacy. I think that's a great way for HR to help support their employees or anybody in the organization as they begin to listen and understand what this means. I work specifically in healthcare, and you would think in working in healthcare there would be maybe less of a stigma and it would be easier for people to seek help, but it's actually harder because they're taught as they go through their schooling and through their licensure that they really are there to take care of everybody else but themselves. And so I think understanding that, and every industry is going to have a different dynamic. We've created some videos around just caring for the caregiver. And so we've got a clinical psychologist that works for us that is talking about how it's okay to have bad days, how it's okay to, not be okay every step of the way. And so I think building that health literacy is really what's going to give you a foundation as an organization to begin and put in some different programming, like your EAP resources, to help and mainstream those, as definitely there's stigmas out there that I think we have to overcome.
Thank you so much, DJ. I totally align with you. I think mental health literacy is literally the right way to go. I think it's the right way to go. As HR practitioners, we need to begin to first. I think Jeff had mentioned it. It has to begin from self-awareness. We need to be self-aware and then clearly understand if we're mentally ill or we are fine, so that we could extend it to other people. So I think I totally align with DJ and Jeff. Thank you.
And I'm looking at the comments here, and a couple of people say, I stopped asking people, how are you? And instead started asking people, how can I support you? And have gotten totally different answers, and answers that are more real and connected. And Renea, I hope I'm pronouncing that correctly, says, one of the members of my team suggested daily check-ins, 15 minutes of saying how each of us is doing. We found that daily was too often, so moved it a couple times a week. And we also added a well-being activity for the team.
I love the how can I support you? Like
Yes.
That's just opens it up for a whole different conversation depending upon where someone is, and really allows you to meet the person where they are. It could go in a professional route. It can go in a health route. It can go in so many different avenues. So thank you for sharing that.
Absolutely. I always love hearing what everyone is doing and what best practices they're implementing within their teams. We also have Brad, who brings up an important point. He says research shows that men are less likely to seek support. And he asks, what are you seeing that's working to better support men who don't necessarily pursue nor resonate with traditional talk therapy? Any thoughts from our panelists on this question?
Yeah, the system that we put in place at Centera Health was EdLogix, and it was a gamification software where you would go in and play games to learn about specific topics. So if you wanted to learn about mental health, you would click on mental health and you would play myth and fact games. You would play different types of games to be able to learn more about that topic. And so we found that people were more open to exploring in a fun way, in a creative way, and less of the stigma of I need help, but more of I'm just trying to learn more and I'm just trying to educate myself. And that opened the door for, okay, now I'm educated and I know that I need help. Where do I go? And that's where EAP help was then able to help lean in a little differently once people felt comfortable. Because they had more information.
One thing I'll offer up is I actually was surprised that I started crunching some numbers and realized that I've been involved with over 500 engagements in the last 10 years. And one of the things that I've consistently encouraged leaders to do and seen tremendous results from it is for leaders to lead with vulnerability themselves. So especially on the question of, men being less likely and certain races are less likely and certain, and I don't even know if it's men, because there's a lot of stigma associated with women and women speaking up or women having to prove their strength and whatnot. So I don't think it's limited to men. I think it can also vary culturally. But what I have found is that when leaders are willing to say, yes, this is difficult. Yes, I am struggling. It actually is more of a motivator than a demotivator, I found, because it encourages employees to bring forth their own concerns and have those conversations.
Thank you for sharing your thoughts on that. So we've talked a little bit about HR's role in this process, but the harsh reality, unfortunately, for a lot of HR teams, as we all know, is budgets are being cut. In some cases, HR headcount is being cut. So Odafe, I'm going to come to you for this question. How can employers tackle burnout and stress in cost-effective ways, especially given this new reality of limited budgets?
Okay, thank you so much. So I like to start with the how can I support you? I mean, it's I learned that now, and I think it sounds really beautiful. I think that's one of the ways to totally it totally changes the narrative. Instead of saying, how are you and how can I support you? But first and foremost, I think one of the things I would literally focus on is how to maybe create flexible work times. So technically, I assume if I manage a team of about 370 people at the moment, and people do not necessarily have to come to work every day. So there are working days, and then there are days people don't have to come to work. And what I've done is I've had to set up some metrics to measure the levels of engagement between when we were working 5 times a week and now that we're working just 2 or 3 times a week. And trust me, the metrics literally just point to the fact that there's more engagement now. So that's one of the things to look at. So, I mean, if you literally reduce the day at work, you're going to save some cost. Some other way is to pay some attention to emotional intelligence and, educate top leaders on emotional intelligence. A lot of top leaders are so focused on revenue, focused on money, and they literally forget about the people. So I think if people know more about that, and I don't think that that's so much cost. I mean, it's education is, yes, it's expensive, but I mean, it will save you the stress. Eventually, it will reduce your retention level. So I think those are like the major 2 things that I would literally recommend. They are cost effective and somehow they still get you the desired outcomes. Thank you.
I think some of the things that, it's not popular. It's hard to do because, like Jeff said, the new word is how are you? And you say busy, but it's slowing down so we can speed up. Even in patient care, we've started to put chairs and are committed to sitting down and talking to the patient, not just standing while we're talking to the patient. It's really creating that time to be able to use that emotional intelligence. So we need to train leaders and teams, not just leaders, on emotional intelligence, how to recognize when someone's in distress, how to recognize when someone needs help, creating psychological safety, making sure that it's okay not to be okay, and that we have support and people around that can help whenever that happens. Specifically in healthcare, we see people that go from one patient being deceased and have to go right into another patient's room. And so we put things in place like it's okay to have that downtime. So we actually have a time frame by which we will not fill a room when a patient's deceased. We'll leave that room vacant so that the team has the opportunity to reflect and mourn if they need to before they need to go to the next patient. We have chaplains, we have other things on site, but we also trained a specific core of people who are dedicated and interested in helping to create psychological safety. These are team members, employees that had a passion for this. And we allowed them to go through courses with psychologists, therapists, social workers, others to help understand what are some of the signs that they need to look for in their colleagues. And then the colleagues also know who's on this work group so that if they don't feel they can come talk to their leader, there's psychological safety in talking to a peer that may be able to connect them with resources and support. And so not just putting it all on the leader's responsibility, but we're all being aware and we're all looking out for each other and we're all here for each other. And we have this environment of psychological support.
I also want to talk about the behaviors. We started off talking about culture versus policy, but there are behaviors that cost nothing. And if you just make managers aware of it, I know some things that I do, the number of times that I've called someone not realizing they're on leave, and they're like, oh, I'm really sorry, I'm just catching the plane, And lots of people will make the choice of, well, I've got you, whereas I will do, okay, call me when you're back. And making people aware of the difference between those behaviors and what message that sends. I test my teams. If I see them online at night, I'll ask them a work question. If they start answering me, I'll say to them, "You failed. You're not supposed to be working now. Get off. Change your status." Just to send that message that I don't want you working at home. And then the most important one, because I do send emails at 6 o'clock at night, asking my team a question, letting them know, yes, it's 6 p.m. I'm not expecting you to respond today. Please, get back to me tomorrow, because that always getting the messages. If we're not setting those boundaries and helping our teams set those boundaries, it can be really, really challenging. So thinking about behaviors, because behaviors cost nothing.
Great points, and our participants are chiming in as well. Natalie says something which might shake things up, adding demonstrating EQ with tangible examples to the scorecard. Suzanne talks about psychological safety and communication training for peers and change and support from within. So great points. And someone else talked about, Kelly says, great points, Adafe. So much of this seems to be about building foundational pieces. Obviously, we need to keep the bottom line in mind, but we have to build around human beings first. I love that thought, being human-led first. So we've talked about the role of leaders. We've talked about the role of HR. Now, as we look at the enterprise, broader culture, what I want to know is how can organizations intentionally foster a sense of community to support mental health and create a more resilient and connected workplace culture? DJ, let's start with you on this one.
You bet. Thank you. When you talk about mental health, we've talked about the leader, we've talked about the organization, and now the community. And I think that honestly, the community, gosh, I would hate to say that it's more important, but if you think about anything any type of health achievements we've had over the course of the last 30 years, it's because we've mainstreamed that topic. When you look at cancer research or how we've, quickly, through COVID-19 and how we were able to handle that, the more people that knew about it, the more resources that were out there. And when you think about your workplace, most people spend more time with their coworkers than they do with their family and friends in any given week. And so it's the perfect place to begin to develop that community to help provide that support. I think it goes back to talking about that health literacy. That's where I think it really starts, is making sure that you've got that baseline so it becomes very common in your culture to begin to talk about, like you had mentioned earlier, Jeff, everybody says that they're busy. I just said it this morning. I was at a meeting and somebody asked me how I was doing. And I said, I'm busy, because I think that is the normal term that we use now whenever we say hello and I think that if we're not busy, that's probably a sign that maybe you don't have enough to do. And I think we need to change some of those stigmas. And I think that it really comes back to that health literacy, creating that community and that foundational support so that we're all speaking the same language and we can develop resources, programming, for each other as we all go through this together.
I'm looking again at our audience comments here, and per usual, you all are not disappointing. So someone says, yes, Dahlia, have this in my signature. If my email finds you in a busy time or during off hours, please do not feel compelled to immediately respond. I use a very similar practice, and I love that. Kimberly says, Mel, wonderful to hear that your team gives time and space between patients, especially when one passes. What a thoughtful and rejuvenating practice. Sherry says, creating ERGs helps connect the employees to each other, especially on a global level, giving them the ability to lead and develop while the company provides the right training and resources.
Sherry, one of the big things about getting the volunteers for those to be in that peer network, we started with ERGs, and they see people both in different aspects, both at work and outside of departments. And so that was very successful in having some folks that were in our ERGs that were trained to identify when people are in need of support.
Malvika, one thought, this may not be a popular comment because I have definitely used the email signature about, I'm working when's convenient for me, don't feel obligated, etc. And yet I have found that when I am the recipient of off-hour messages, that burden is there. Whether I respond or not, I'm processing. I'm mentally thinking about that response, and that creates an emotional burden, whether I'm actually sitting down to type or not. And what's unsaid there is, yes, I'm checking emails on a regular basis. So that's still burdensome. So several of you in the chat have commented on the delayed send. And I would just like to give a shout out to the delayed send during whatever regular hours are. And last company I worked for was Adobe, and we were clearly global and whatnot, but still working within your hours to the best of your ability and leveraging the delayed send, I think will minimize the burden. Even if you set the expectation that you don't expect a response, that mental burden, I think, is still there.
Great point, Jeff. Thank you for sharing. My goodness, so many great insights, including from our participants. And I hate to be the one to remind us that we only have 5 minutes left. Thank you, everyone in the comments, for your wonderful insights. So let's make this last 5 minutes super impactful. So panelists, if you could leave our audience with one piece of advice on tackling burnout or stress in their workplace, what would that be? And this could be something we've already talked about that you want to underline again, or a new idea you haven't had a chance to share yet. But this time we'll go reverse order to how we started. So Dalia, let's start with you.
So the one thing I would want people to take away is the role that they can play in eliminating the stigma around this topic. So leaning into the conversation, leaning into it being normal, to say, I'm not okay, I need support, I need help, or I just need to be with you and not be thinking about anything else right now, and making that as normal as possible.
Wow, that's a great one and hard to follow. I think something that I've done is really beginning to mainstream. You know, when you come back from a weekend off or an evening off, and people ask what you did, rather than saying the 50 errands that I ran and the house I cleaned and the activities I ran my kids to. This last weekend, I went out with friends, hung out. I read a book on Sunday morning, and I spent some time outside. And so beginning to normalize not necessarily your achievements, but what you did to relax and recharge, and making sure that that's okay, not only with you, but the people that you share your life with, whether that's partners, family members, friends, and beginning to mainstream that.
Jeff.
So one thing that I found very helpful that I offer for consideration, and you can even reply in chat with your answer to this, but because words can be difficult, sometimes numbers are easier. So sometimes I'll ask people that work for me or that I work with, on a scale of 1 to 5, how's your engagement today? 5 being high, 1 being low. And then whatever that response is, I would then be able to chime in and say, what's to keep you from moving from where you are to a 5? What's in the way? What's top of mind for right now? And that's driven consistently really powerful conversations very quickly.
Okay, thank you so much, Jeff. So apparently, I think for me, my parting word to be, we all must first remember that we are human beings, and it is okay to say I'm not okay. I think we must leave this room with that. It's okay to actually say I'm not okay. And as leaders, I think we must begin to encourage people to speak up and stay away from stigmatizing people who feel this way. I mean, they're human beings, and somehow look for some way to get them better to doing their job in a better way. Because I mean, somehow, because we have stigmatized these guys, they have literally just either kept quiet, and it has in turn affected our productivity. So it's okay to say, I am not okay.
And my advice would be, it's a team sport. We have to change a culture, not just within our organization, but within our communities and beyond. And so in order to do that, we have to get everyone to help and participate. This isn't another leader task. This isn't another HR task. This is about educating people about their mental well-being and how we can support them and the tools and resources that are available to them. So making sure they really know what's available and how to access it. And they can do that anonymously, confidentially, or they can talk to a friend, colleague, or leader to be able to get that support and get to the right place. So team sport.
Well said. Thank you so much for being here today. Thank you to our panelists for sharing your time and your insights with us, and everyone in the comments for your participation and your energy that you brought to the conversation today. Enjoy the rest of the summit. We'll see you soon for the next panel, which is From Awareness to Action, Moving Beyond Conversations to Implement Real Mental Health Support Systems. Be well, everyone.
Hello, everybody, and welcome in. Good morning, afternoon, evening, night, wherever you are in the world. I'm so excited to be here with you today. I am your moderator for this panel. I'm Lauren Lefkowitz. I'm an executive coach and fractional chief HR officer. And I will be leading this panel on the topic of From Awareness to Action, Moving Beyond Conversations to Implement Real Mental Health Support Systems. I'm really excited about this topic because I think we're in this world where we are emerging from a time and place where we really didn't talk about mental health, and now it's front and center. So, welcome the panelists to the stage. I'm so excited to have an incredible panel today. Thank you all for being here. And we're just going to start with some introductions. Tell us who you are, where in the world you are, and what had you come to this panel today. And let's just go around the room. Tiffany, then Melissa, then Jessica, then Jessica Lewis. I didn't realize we had two Jessicas today. And then Shelley.
All right. Well, good morning, everyone. I'm Tiffany Deans, and I am the CEO and founder of Grounding Work. I am actually here right outside the nation's capital. I'm about 10 minutes from DC. And I'm just really excited and really happy to be here. And why I am here, what led me here, mental health has become a true passion of mine over the last couple of years, just with myself personally, and then of course at work. So let me just dive right into my passion. And so this is just, it feels good. And I'm really just happy to be here with all of you. Thank you.
Good morning, everyone, or evening, wherever you are. I'm Melissa Schwartzman, and I'm so passionate about this topic. So I'm a chief people officer. I also have always been a licensed mental health clinician. So I'm so excited that mental health in the workplace has taken a really prominent seat now. So I really love having the blend that I've been an HR professional and also now able to use my clinical skills to really have this great balance to have mental health in the workplace. And I'm based in the Metro New York area.
Good morning, afternoon, everyone. I'm Jessica Bivens. I am the Director of People at a nonprofit museum, Speed Art Museum in Louisville, Kentucky. I'm still recovering from our Kentucky Derby this past weekend, but we're doing okay. I'm here. I'm excited to be here. Mental health is very important to me personally and professionally. The theme, it's okay not to be okay, is prominent in the workplace right now. So I'm super excited to be here. Thank you so much for the invitation.
Hi, my name's Jessica. Like all of you, I have been an HR director for the last 10 years, and this is a topic that I think has become so prevalent. It always was, but I think in terms of what's going on in the world and the generations coming up, it's become even more important. So it's something that I deal with every day in my HR practice, personally and professionally, and mental health. I just think it's such a timely topic with everything that's going on, but also really how to create and implement real strategy. So I chose this topic to be part of this topic for really understanding and having this conversation, because it's not just conversations, it's again, really creating those strategies around real mental health initiatives.
Ooh, Lauren, you got me following up Tiffany, Melissa, and both Jessicas. Okay. Hi, everyone. I'm Shelley. I'm a director of global HR and inclusion for a cybersecurity company. And also I'm the director of people and culture for a nonprofit board for HR Tampa. What drew me to this is also like kind of what everyone else, said as well too. This is my passion. I think these conversations are important. I know that we lose a lot of people in silence. So anytime that we can have these conversations and push this change, like I'm gonna show up, I'm gonna wear a t-shirt that says I heart mental health or whatever it needs to be, because that's how important these conversations are.
What a powerful panel we have. I'm so excited to talk to all of you today. Panelists, I just want to ask you to be on mute if you're not speaking to help us avoid echo, and also to indicate when we're going to speak, taking ourselves off of mute so that we can see each other. Our first question is really more like a point of discussion. So before we dive into what to do and how to impact. Let's just talk a little bit about the work environment and how attention to mental health or inattention to mental health has shifted in our world in, let's say, the last 5 years, where so much has turned upside down. We've gone remote. We've brought people back to office. We are more global. Tell me a little bit about what you've seen about how mental health awareness and attention has shifted in the workplace.
I could go. So I think it shifted a lot. I mean, I think everybody uses like COVID, right, as a benchmark for a lot of the shifts. So I think what happened, like you said, a lot of in the office, out of the office, how are we communicating? How are we keeping in touch with people? And I think a lot of people realized what life was like, right? We had the change of employees trying to make changes. A lot of people said, I took value of my life. I'm going to see what's happening. And I think we had a lot of managers who had to really feel connected to people and understand what was going on for people. People really evaluated what life was like. So I think it put a burden on employers to kind of really figure out how are we going to look at employees and how are we going to stay connected. And as people were making these personal changes and realized wherever people were, whether it was physically in the workplace or remotely, people bring their whole self to work. So it's not just what are people doing for their goals at work, or what's happening for them personally. People realize they got a glimpse of, I could put my chicken in the oven and I can be on a work call. I could go to the baseball game. I can do my hobby that I have if I don't have a family. So I think it really took full stage that we have to look at the complete person. We talked about the generations at the beginning. What are people looking for when they come to look at an employee? But I think also we needed to queue up a little bit more at being in tune with a whole person. What are we looking at if somebody comes to a meeting and they just not acting like themselves? How are we stepping up to make sure that we're looking at an employee and making sure that we're seeing if somebody's not acting like themselves? And then what are we putting in place as employers to make sure people have resources? And again, making sure it's okay not to be okay, and also having leadership model, hey, maybe I'm taking a mental health day. So to answer your question more succinctly and give other people a chance, I think it's just recognizing it's okay to look at a whole person, and that mental health is just as important as, are we making deliverables? Are we making our clients, but are people okay? And are we looking at the whole person?
I think what I've seen is. Oh, I'm sorry, Tiffany. You want to go ahead? I'm sorry. I think what I've seen are healthy boundaries. People are starting to feel comfortable setting those boundaries. I think before it was, I'm busy. I'm going to stay busy. I'm going to work over the weekend. I'm going to, answer my emails. But I think now with there's always these good and bad things that happen from COVID, as Melissa mentioned, that is being sort of a benchmark. But I do believe that those are some of those pluses. People had the opportunity to really take stock of their life, their mental health. People looked, had different experiences with COVID in terms of, family members and loss, and, just that isolation. And then once we kind of got back to somewhat of our new normal, people felt more courageous and more psychologically safe to say, you know what, I'm not answering emails after 6, or I'm not answering any emails on Sunday, or whatever, that is. And it's good to see. I mean, I think it's really, courageous, I guess I should say. I mean, because some people feel like, I'm the boss, or I'm running this department, and I need to be available to everyone. But it's like, well, yes, but you need to be available for your family. You need to be available for yourself. You need to check in with yourself. So I really do believe that those boundaries that people have set, is really sort of one of the bigger changes that I've noticed.
Jessica, I love the point that you made about empowerment and that shift, because I feel like I can't speak to that enough, especially with COVID, especially with all of I feel like we're seeing an uptick in layoffs and stuff. And if we're being honest, we've seen companies not handle that well. We've seen it be kind of almost inhumane, or not have empathy in the way that people were handled, and having to jeopardize their mental health, their livelihood and stuff. And so I feel like there is a shift in that empowerment, where people are all of a sudden realizing, like, at the end of the day, these companies are going to make a business decision that's going to be considered business, and it's going to impact my livelihood. So I need to start putting myself first, putting my mental health first, at the end of the day, because of all these decisions where we're seeing our friends, colleagues network. I see so many people in like our HR Tampa network, and they're experiencing layoffs. And I'm not going to lie, the way that some of these companies have handled it has not been with respect and with empathy.
I would also,
And I think so much, Shelley, to your point, is from a retention standpoint, from talent acquisition, people are looking for that. So when I'm hiring, for example, people want to know, what are your workplace policies? What are your no meetings policies? What are your layoff guidelines if you're laying off people? What are your EAP? So from a retention strategy as an HR leader, people will not be joining your organization if you are not putting mental health forefront. And also, as the next leaders, they want to be trained on it. So again, what are you investing in leadership? When I make someone a manager, they say, how are you going to train me on mental health? What do I look for? I know Melissa talked about, certain things that you're looking for in a meeting. People want to be trained. So I think that has really, really changed and really, brought this conversation to the forefront in a way that I think obviously it needed to be.
Tiff, were you getting ready to say something?
I was, thank you. I'll just go ahead and round it out. I'll be very brief. But I did want to say it was Melissa and Jessica B. You all had talked about, COVID, and I feel like that was a benchmark as well. I feel like there are a lot of things that people did have control over, but then there was so much that we didn't have control over. And it was like everything just kind of happened all at once. Things shifted. We couldn't control work. We couldn't control health. We couldn't control loss. And so I feel like it was really hard to compartmentalize our lives as we were, okay, this is work, this is home, this is this. Everything just became one big like blob. And so it forced us to kind of take control of our mental health because we didn't have anywhere else to go or any other option. So I'll say, I think that's a big piece of it. And then also I feel like Gen Z, they have definitely come in and have really set the tone for what they are going to do, what they're not going to do. And I feel like the way they are is really helping to shift the workplace and like, okay, we have to, change up for this incoming workforce who's like, these are my boundaries. This is what I'm doing. This is what I'm not. And they are so on like their mental health. So I do want to give them a shout out.
Tiffany, my husband's a people manager, and one of his employees let him know that she was going to be remote that day because she didn't get good night's sleep and the vibe was off. And I was like, more power to her, though. I wasn't even mad at it. I was like, it'd be like that sometimes.
Right.
Do you.
Oh my gosh, it's so true. I love the willingness of Gen Z to just like come out and say it, right? Like, I'm a Gen Xer. My version of the vibes are off are like, I'm really sorry. I'm not going to be in, or I'm going to come in late. I'm trying to put ice on my head to get rid of my migraine, right? Like the Gen Z is just like, yeah, I'm not doing it. Love it. Such great insights and really good comments coming in from those watching. We have more than 350 people watching us right now. So I heard you all talk about really looking at the whole person, doing some real work around boundary setting, that's my heart, is boundaries. I love boundaries. And that people are demanding this. Employees are demanding this. And whether they're asking during the interview process or whether they're in the midst of everything, there is an expectation now that attention to mental health is integrated in the workplace. So I think, we've seen this, the shift in trend be from like, we don't talk about that stuff at work to we have an EAP and let us tell you about it. And we promise it's anonymous, even though you're probably not going to believe that. And then, some laws coming into place in different countries about mental health coverage in your health plan, whether that's a national health plan or private health plan. And so we now have this integration of we believe in self-care. We believe in mental health care. How do we transition from treating mental health as an individual, like, hey, you go take care of yourself. You go take care. The vibes are off. Don't come in today. Absolutely. Go take care of yourself. How do we transfer that from an individual responsibility to creating an actual culture where well-being, where mental health is paid attention to, and we are all looking out for each other?
I'll take a stab at that. For me, I feel like just normalizing the conversations, the dialogue with staff, those opportunities to talk about, like you mentioned, the EAP. I provided a training once for our staff, and it was let me share my screen. Let's go to the EAP site. Let me show you all the resources that are available here to you. Did you know this? And I really did get a good response, because there was a lot of staff who didn't know that what was available. So I think sort of just talking about it, again, normalizing it. So like with the EAP, like it's not about drug addiction. I think a lot of people only think of EAP when they think of, oh, I don't have a drug problem, or I don't need that. But it's like, even mental health support can come in the form of providing resources for caregivers, for those who are looking to adopt, those who are looking for all these other resources that are available on EAP that I don't think staff or managers or anyone are always aware of. So sort of making it part of the culture, sharing those webinars that come through for your EAP. Not all staff look at the emails that come through, but making sure you share that out there, post the different stuff that's that's available to them, so that it's not something that's uncomfortable to talk about in an all staff meeting. But it's even if it's just a simple reminder of hey everyone, I know we have a lot going on, but just make sure you're checking in with yourself, making sure you're staying hydrated, and making sure that you're getting plenty of rest. Just those little things, I think, sort of provide that that's like a safety net for people to know that, okay, when I go to work, I know that I can't be my whole self, but I also know that they support me, asking those questions. Even is there anything I can do to help you? How can I support? I think those are just important things to sort of build into your culture.
Jessica, I agree with all of that. And sorry, Shelley, you want to go first? Go ahead. I think it's like everything goes from the culture, which is always hard to change, and from the top down. So I think it's great. I think education is really important, and modeling as well. So I even think like even going as big as sometimes with the town halls, right? When there's all these updates about what everything's going on, I think wellness can be part of the town hall. So talking about whatever wellness initiatives are going on, and talking about kind of mental health and wellness and how that's an important part of what's being offered that the company has, and talking about the EAP and normalizing it. And then as you cascade down, right, when people have their team meetings, talking about how's everybody, doing, remind people about the different offerings that have been talked about at the town hall. And I think, right, at team meetings, we all had our own, right? And we've attended and sat in when we were the HR rep at other things. But I think it's part, not just only talking about the metrics and how we're doing on all those things, but let's have some sense of community and ask people how they're doing, what they did over the weekend, and incorporate that. Like, are you doing stuff like to take care of yourself? Did you get out in the park this weekend now that the weather's changing? Again, to Jessica's point, making it part of the culture and normal to self-care, health and wellness, but make it part of the, not just on the individual. Are we all looking out for each other and making sure we're doing these things together?
And I think to add on about the culture as well, too, because, it is important that organizations are offering opportunities, whether or not, I feel like you can see all the different perks, whether or not it's yoga class or in the break room or meditation or in the middle and stuff like that as well, too. And, or free gym passes and whatnot. And all those things are great, but it won't matter if we're not addressing some of the inner issues within the culture. So if people are experiencing toxic leaders, have unmanageable workloads, if people don't have autonomy, if there's misaligned expectations as to how they're supposed to be performing and producing, none of those things really, it's almost like a Band-Aid to a bullet hole at that point. And so we have to be sure that we're actually addressing the culture and the unspoken rules of the culture as well, too, in order to actually have those things be effective for the type of change we want to see.
I completely agree, Shelley. And I think so much to your point, is about workplace design. You can do all of these yoga and meditation classes, but if you're not aligning on expectations and if the leaders are not on board, what I've seen is, sometimes leadership is not aligned, and really it does need to start at the top. The leaders need to have buy-in. They need to be showing up. They need to be creating these systems. They need to be setting clear expectations. They need to be dealing with toxic managers, Shelley, you talked about. That is really the support that needs to come from leadership. And I also think leaders need to start with policies as well. For example, we're launching menopause in the workplace as a policy because that has been, a huge topic for us. And I think it's so important to say, hey, I'm listening and I'm going to start a policy that, guess what? Yeah, maybe on your cycle, you're going to stay home, but I'm going to integrate that and listen to you. So I think, again, it's really creating that workplace design. Shelley, you talked about getting that leadership buy-in and really, promoting policies that are supporting the mental health overall of the culture.
That policy one is huge. I feel like it's exactly like what you're talking about, because it's like when you go over having something like, menopause policy, going over, you can typically tell how an organization feels about mental health when you can look at their bereavement policy and see how that's written, how they include family members or direct family members, if miscarriage is included in it as well too, looking at maternity and paternity leave options as well too. Is there a maternity leave? Is it open for, non-birthing parents, things of that nature, people who are adopting, and also partners as well too. Being able to look at some of those policies that would help support someone's mental health while going through any outside life things, which we're human, outside life things are going to happen, is important as well too, to address as part of the culture. I love that you have a menopause policy. That's awesome.
Yeah, amazing. As you were all talking, and one of you mentioned, yoga classes or whatever, I just had this visual and this memory of a yoga class that our workplace had put together. And there was not alignment. It was put together by our parent company. There was not alignment with our deadlines as a company and the parent company. And people came in and they were like, can we shorten this a little bit? I have to get back to my desk. It was like the most misaligned mental health address ever. We're getting
like, namaste, I'm out. Like,
right. Namaste, gotta go.
I got this deadline. No, namaste to you.
Right. We've got a bunch of comments actually, which lead into our next question, about leader buy-in, about psychological safety, about, policies and how they translate into action. So as HR professionals, we often take on everything. We spoke a little bit about boundaries at the beginning, and we know that that's not healthy. And we also feel a great sense of responsibility to our teams and our people. And we really want to drive integrating mental health as a factor in the workplace. So how can HR professionals hold leadership accountable for fostering a mentally healthy workplace? And, secondary to that, how do we make sure it's not just another responsibility that HR takes on and has to pay attention to company-wide?
Okay, so this is big for me. So I think in my experience, what I've learned is that I can have the best intentions, strategies, ideas, policies, but if leadership is not in alignment with it or not, partnering with me, it's not going to be effective. And I have burnt myself out trying to do things because, like you said, Lauren, like we're trying to do things and make everyone, feel good and want to come to work. But also I have not been successful at that in the past just because I didn't have leadership supporting me as well. And so and I know sometimes that, this is a safe space. We're all HR professionals. So I know that can be like a very tricky or challenging thing at times. But if it's not a direct, like, hey, I need you to, support this, I need you to model this, then I just make sure I just insert it in everything. So whenever, I'm having a meeting, right, wellness or wholeness is going to come up. I'm going to make sure that at least everything that I do in my HR capacity is aligned with, wellness at work, and making sure that the employees feel good. I know that the most effective mental health strategies and things like that happen when not only when leadership is in alignment, but when they actually model it. So like if you're at a meeting and if they're like, you know what, yesterday I had a bad day yesterday, or I'm taking the day off because, X, Y, and Z, that starts to kind of break down the walls. It starts to build trust. And then that will kind of start to build the foundation of that psychological safety in the workplace. But we really can't do it without leadership. So that's my 2 cents.
Listening to what you said, it made me think about, maybe a couple of years ago, mindfulness was like the buzzword, and mindfulness activities and things to start your meetings off with were, you know, first 5 minutes of every meeting, and I've seen that sort of fall off a little bit. We're busy. We got to get this. We have an agenda. We have to do things like that. But I was thinking, as I've brought up the boundaries, I'm like, I'm not very good at setting them for myself. As HR people, it's like, oh no, I make y'all's boundaries, not mine. Like, no, I do everything for everybody. I'm available for everyone. And I've had people say, well, who do you go to? Who supports you? And it's like, I got to remember to model the behavior that I'm really trying to push out there. And, I've tried to make a conscious effort of doing that in instances, but, just making, it sort of part of every meeting, as far as, kind of holding leaders accountable. Maybe doesn't have to be a mindfulness exercise every time, but, at least, just checking in with everyone, even if it's just an email, sending out to your leadership team, hey, just checking in with everyone. How are we all doing? Have you checked in with your staff? We had a really, crazy weekend, or we had, whatever those things are that, you want to call attention to. I think just sort of trying to make a conscious effort to bring those things up or add those to agendas, and model it yourself, I think is really important as well.
Tiffany, I feel your pain about kind of get the leadership behind things sometimes. So I think us all here as HR professionals today can understand what that takes sometimes. So I think the reality is sometimes we have to show them some metrics and some data about what it will happen if we don't do some of these things, because we lose some of our good people, right? And then we kind of do a lot of the things that Jessica was kind of saying, which is to model and educate and show the leadership like what it would look like to introduce some of these things, and then show them the benefits of what it will have to have our high potential and also retain some of our brick and mortar people. So I think it kind of goes with the reality. We sometimes have to use our metrics and show how we can get the people to stay and also attract the right people. But then also, to Jessica's point, we have to kind of show them how we're going to educate them and model how to do these great practices, and then hold them accountable to make sure that it's not, we just don't start it, but that we kind of have to sustain it and continue it. And also, Tiffany, to your part, you kind of have to make it part of the culture and bake it into all of the policies and practices. I'd love to someday see these things more in kind of the performance form, right? Are you a mental health ambassador? Are you making sure you're putting these things into practice, right? So love it, what everybody's saying here, but the real proof is, are you doing it sustainably and consistently, and the results are in, are the people happy and feeling like you're really putting it in to all the things that the company's offering.
And Melissa, like what you said as well too, just like about like the metrics. Like I also feel like, and it's easier said than done, because obviously it depends on like the type of dynamics and between leadership and where HR sits, if they're viewed as someone as a strategic partner or someone that's admin and stuff like that. So there's a lot of things that come into play with what I'm about to say. But like what you said, being able to hold people accountable through metrics, because you can pull metrics as far as it relates to retention, turnover, how much people are taking off, even down to how many people are having to take sick leave as well too. Like you can see signs there to be able to hold people accountable in that way, even down to seeing how much turnover is common amongst certain leaders and seeing a commonality through that way as well too, if something needs to be addressed. And I think HR is in a unique position as well, because being in human resources, at least from my experience, HR is definitely going to be some of the first in the organization to see how companies will treat people at their worst. So it's like you can see really what the culture is versus what it's actually saying, and be able to see ways that you can hold people accountable. Because like I know that even just with seeing some of my friends over the past years, like one of my best friends, he just had a premature baby, and it was very surprised, stuff like that as well too, extremely stressed. And when I came in to visit him, he was still working by his wife's bedside, like just clocked in with like the little table and things like that as well too. And so those things speak to the culture and how they prioritize mental health.
I couldn't agree more, Shelley. And I also think one of the things that has been the strongest KPI for me is exit interviews. People, they can say, oh, where's the data? I remember saying, okay, well, here's 6 exit interviews where they're all saying this manager, is doing this. So you can't lie, right? So I think also looking at, really listening to the employees, doing pulse surveys. Pulse surveys for us have been a game changer, really, because you really see the trends that are impacting mental health. And to everyone's point, you can really see, is this lip service, or are you actually doing something to combat mental health? And the pulse surveys, the exit interviews, really giving opportunity to the employees to have a voice. You see those trends. And when you give people a platform, they will say, and you can say, do I actually care about mental health? And to everyone's point, is it actually baked into the culture? Does it matter? Are employees seeing that? And I think that has been for us a game changer, because you can't debate if 10 employees are saying the same thing, right? So I think really the proof is in the pudding, in terms of that has been, a metric, a KPI that's been really helpful, those 2 exit interviews and pulse surveys.
Jessica, it's almost like I've paid you to lead us into the next question. So thank you for that. We've got a lot of comments about metrics and measures and really holding people accountable. And sometimes in these kinds of discussions, we talk very globally about the importance of, and we all nod in agreement, and then people walk away all motivated, but without tools. So let's give our audience some tools. What are some specific examples, training or accountability measures or metrics or feedback mechanisms that we can use to evaluate the effectiveness of mental health initiatives, the real weaving in of mental health initiatives? What have you done that has really worked?
Like Jessica was saying, she pretty much said it all, but like definitely like the pulse surveys, things like that have been really effective. And it was something else I was thinking of too, when people talk, it's data, but also silence is data as well. And so you can either see when people, if they don't want to give exit interviews, or if they aren't participating in the surveys and things like that, that is also data. That's also very telling. So I know a lot of times like we do, and I think it's good to look at the hard metrics and the numbers, but also there are also things weaved in there too to kind of pay attention to. But pulse surveys are really helpful. And I think it was Melissa who mentioned about putting a piece of that in performance, which I think is great, especially for managers and for leaders, to have a component in there on on what they're doing to make sure that their team is okay, because that is part of leadership and they should be, evaluated on that. So, yeah.
Something that we did recently as we were reevaluating our benefit options was look at the utilization rates of our benefits. We also, looked at, the prescription drugs that our staff are utilizing and where that money is going. And as you look at that, you see the number of people that may be on antidepressants, and you see the ones that may be on blood pressure medications. And, those are the things that you think about when it's like, okay, let me send out more specific information. Let me make sure they know about this free program that comes with our benefits, where they could get a, wellness coach or someone who could help them with their dieting, a smoking cessation program, things like that. Those are really good indicators that we found were really good to help us figure out like maybe where we need to, during open enrollment, where we need to train or where we need to, support and provide resources, and again, like what Jessica and Tiffany said, the looking at retention rate, looking at the absenteeism, the exit interviews are always a really good indicator of the culture as they saw it from their perspective. So it's really good information, and I loved the performance management piece of that as well. If we want to build that into the culture, that needs to be something that's measurable, a measurable thing that we're looking at as we're measuring the performance and overall leadership sort of capabilities and things like that. But definitely you can get that information anytime from your providers on your utilization rate. Like, how many people are going to this EAP website? Okay, I only saw very few people. Okay, that means they don't know about it, or it's not easily accessible to them. Is there some kind of barrier that we need to remove for them to have access to it? Is it a cultural thing? Is it a language barrier? Is it just access to it from internet perspective? I mean, there's so many barriers that, that people have to accessing some of this information. So I think it's important to kind of look at that, and it helps you determine like your next steps and how to move forward.
Yeah, Jessica, I was going to piggyback on that because it's interesting. So I work with my clinical training. I actually worked at an EAP, and I actually was surprised when I also went back to work in the HR space between the two, how much data there actually is that you can actually get at the EAP. And we were all talking about how sometimes employees are hesitant to use the EAP because they somehow think it's still not going to be. But same thing with the healthcare information, right? How much is that not able to be utilized? But back to my point about the EAP, you can actually get data like from, not by employee name, that still is definitely confidential, but you can see how many people called in like for relationship issues. And you can see, because a lot of the companies offer not just for the individual, but sometimes for family too. So you can kind of also dig a little deeper. But one thing I just wanted to raise here is that obviously divorce, right, is a very big impact on the workplace. And you can see how much that from an effectiveness. So sometimes knowing, again, and if somebody is going through a divorce, if that's made apparent, that's another thing to look out for people. And you can kind of sometimes see how much relationship issues are really a big impact. So to Jessica's point, digging into that EAP data, that is not a confidential thing, but just bigger themes, that really helps out too. And just to that performance thing that I was mentioning, I had implemented it when many years ago from a behavioral component, because I had worked for a PR advertising company, and there were big sellers that were big income generators, revenue generators for the company, but they treated the employees terribly. And I took a stand as the HR professional, and I said, we can't have these managers here, even though they're big revenue generators. So I had instituted that as the behavioral. So that's kind of where now I've been beating the drum. Same kind of thing. If we are having managers that are not promoting this good mental health, or maybe even being a cause of somebody not having good mental health, whether they're overburdening people with project work or burnout, other things. So I think it's important to think about that. As we said, it's part of leadership.
I could talk to all of you for the rest of the day about this. Like, I feel like we've barely scratched the surface. So I'm glad this is a 3-day event. Stick with us if you're in the audience. As a final, in just like 15 or 30 seconds, if each of you could share one resource that has helped you with sharing information about mental health in the workplace. So just pick a resource that's worked for you so our audience members can find them.
Being based in Canada, I would say CAMH is an amazing resource. It's the largest mental health sort of association in Canada. And for when I was starting out, they can bring trainers to your workplace. Also the difference between, depression, bipolar. So it really gives you the understanding so you can align behaviors. And I think at a starting point, it was incredible. And we brought in trainers, and I would say that is such a good starting point to have specialists come in. So everybody has that information to what to look for.
I know for me in Tampa, we utilize and I work with NAMI a lot, National Alliance of Mental Illness, and they have chapters. They have like their national, and then they also have local chapters as well too. Like I'm in Tampa, so they have a local Tampa chapter, and so they put on a whole bunch of things year round, and they're always sending out resources and having group sessions and things of that nature as well too. So I would definitely start there from a community perspective, so you can meet like-minded people who want to make a change and who are also trying to make a change in their workplace.
I would, I definitely agree with the NAMI, Shelley. I think that's a great resource. I have found over the years that the insurance carriers, like they are becoming more robust in their offerings and their information. So that is also a really good resource to, check out and see what they have. And then if there's I was able to use Calm, which they have an amazing platform for for organization. So data, just so many good things to use. And they also just have a lot of information that they share as well.
I was also going to share that about the providers, and they do, they make those offerings to come to your site if necessary. But I use this site, Mental Healthy Fit, that offers a ton of resources for staff, and I also go to our local government site. I mean, just to show them what local resources where they can find support. Even if they don't want to necessarily come to me or go to a leader, just out of concerns of privacy, that here's a link to this website. Feel free to go out and see what kind of resources are available.
I echo all the above, and then sometimes Psychology Today, they have some good resources and articles you can plug in too.
And I'll add, there's a book called The 15 Principles of Conscious Leadership that really walks you through how to be a leader who is whole and practices holistically. You all have been an incredible panel to be with today. Thank you so much. If you're listening, stay with us today. There are more panels coming up. The next one is redefining psychological safety at work. And a lot of you asked about psychological safety. So I think that will be an amazing discussion as well. Have a great day and see you soon.
Hello, everyone, and welcome to our third conversation of our first day of the Mental Health Summit. We will have 40 minutes dedicated to redefining psychological safety at work. Welcome, everyone, if you just jumped on the link, or thank you for staying over from our previous conversations. My name is Minola Jacques. I will be your co-host for the next conversation. And I will ask Jessa to help me make the most out of our time and bring the speakers on the screen. And as they settle into their Zoom boxes, I will just encourage everybody in the audience to please use the chat generously. And do consider this conversation open to you, just as it is open to our panelists. And drop your questions, drop your answers, drop your own take on whatever it is that we are discussing. And this is the best way that you can support the community. We learn from each other, and we help each other make sense of this beautiful, crazy world that we live in. So without much more introduction, I will pass the e-mic clockwise as you appear on my screen. And I will ask you to first shortly introduce yourselves. And I have a first challenge. There is a wonderful quote, courtesy of Margaret Thatcher, that says, being a leader is like being a lady. If you have to tell someone that you are one, you're probably not. And this quote comes to my mind quite often when we talk about psychological safety. If you have to tell someone that an environment is psychologically safe, then I have some doubts. So I would love, firstly, introduce yourselves, and how do you recognize a psychologically safe environment? Preeti, it's very, very good to see you again on my screen. Welcome.
Thank you so much, Minola. I'm so glad to be here today with all of you. And really, it's, as you know, it's one of the topics I'm really passionate about. So my name is Preeti. I am originally from Malaysia. I call Dubai home currently. And I've been an HR leader for over 20 years. Various industries, supporting teams, have worked in various countries across continents and multinational corporations. I recently left corporate to launch my own HR consulting practice, and that's where I do a lot of work with leadership development and culture. And for me, the heart of that work is something really personal to me, which is psychological safety. And it's one of those things that really binds that work to the programs that I run and the leaders that I help develop. So yeah, how do I know? I think it's the voice. I think where when you hear silence, that's when you know that something is not quite hitting in the right spots, right? And that's really a telltale sign, I think, of a place where there is no psychological safety.
Thank you very, very much, Preeti. Ngozi, good to see you and good to have you in this conversation with us.
Good to see you too, Manola, and I'm happy to be here. My name is Ngozi Oke, and I've been in human resources for well over 10 years, heading up organizations of different kinds. Currently, I'm also the founder of the People's Talkspace, which actually is an organization that is really at the heart of psychological safety. And so at the People's Talkspace, we actually create spaces for employees to process different events, either internally or externally in society. And so this is a topic that's near and dear to my heart. I would say within an organization, when psychological safety exists because, one, you do hear, sort of playing on to what Preeti said, you are hearing feedback, right? Like some people think that when you hear negative feedback, that something is wrong. And not necessarily, you know, negative feedback can also be a signal that people feel comfortable enough to speak their truth, to express, you know, what they're uncomfortable with, and to share their thoughts. And so feedback, even negative feedback, can be good. And so I say that, so I, you know, I like to think that if you're seeing feedback, if you're experiencing that in the workplace, then that's a sign that you know, there could be some great psychological safety. I'd also say that if there are several reinforcing factors, then you know that an organization understands that psychological safety is not just one thing. It's not just about that survey that you send. It's about, you know, the different opportunities that you take to reinforce that. Are there employee resource groups? You know, is your, you know, survey and the Pulse surveys that you send, are they anonymous, right? You know, just the different opportunities that you take as an organization to create those spaces and to reinforce those spaces. If you can, you know, name several within an organization, then you know that there's some work there that the organization is doing towards, you know, intentionally creating psychological safety. And so the chances that it's there is good.
Thank you. And welcome, Ryan. It's good to have you in a conversation. I think it's the first time we cross paths. We can't hear you. I don't know if it's just me or technology. Yay, now we can.
Better? Okay. I just needed to amp up the volume a little bit. Happy to be here, first time, obviously based on the tech challenges. So I've been in HR for over 20 years, leadership roles for over a decade at this point. Currently, I'm the Chief HR Officer at a community college in Boise, Idaho, USA. When I think of psychological safety, I 100% agree. You can tell if it's there or not based on silence. But I think also what you see is with psychological safety, you have two different types of conversations that are occurring. When it isn't there, you're hearing blame conversations. This person did this, that person did this. It's driven around fear and the inability to be safe making errors. And then what you hear more of with a psychologically safe environment is curious conversations. Tell me more about that idea you have. I'd like to understand this differently. That's an interesting take. Those kind of conversations tend to percolate up more, in my experience, when you do have that psychologically safe environment.
Thank you. Linda, welcome to our panel. Good to have you.
Hi, Manola. I am so excited to be here today to chat with you all. So I'm Linda. I am a people experience architect, I like to call. And all that means is I help leaders and business owners really design their people experiences from onboarding, offboarding, everything in between, and then everything thereafter as well. All, you know, to create the perfect environment for people to feel psychologically safe. So for me, you know, how I know is all the points have been taken, right? So it's kind of like, okay, is there silence? Okay, if there is, cool. You know, then we know there's work to be done. You know, do we have the resources to create the safe spaces? Yes. And what Ryan has said in terms of the type of questions being asked, to add to all of that, I think what's very telling is how different generations, you know, behave, how they feel psychologically safe. Right. So if my millennials are really giving that critical feedback and they feel safe enough to say, hey, leaders ABC, and my Gen Zers are utilizing their EAPs, and my Gen Xers and boomers are really kind of thriving at the performance level, then I know that, hey, psychological safety is present here. We can start there. Without those, you know, it's kind of unfair to kind of have different generations behave in a way that's psychologically safe. That's only defined by one way, right? And so excited to tap more into that, but yeah.
Wonderful. And making our panel complete, Janet, welcome.
Good to see you, Manola. Good morning, everyone. My name is Janet Rico Urig, and I serve Pima Community College in Tucson, Arizona as Human Resources Director over the Talent Management Employee Relations area. Some things that I've recognized in my career in human resources over the last 15 years has been really observing behaviors and the culture. And so, like everyone said around the silence, where I've really found what behavior looks like is that mistakes are seen as learning opportunities. And so when errors happen, that focus on understanding and improvement, not blame. Leaders model that vulnerability by admitting their own mistakes. Asking for help is normalized. Team members seeking and offering help freely without fear or judgment of appearing incompetent, right? Everybody just wants to know that they're doing a good job in their role. And so struggling isn't hidden, it's acknowledged and supported. And my third one is feedback flowing in all directions, right? So I love what you just said, Linda, about millennials, because, right, there's nothing that constructive feedback from both peers and managers in a psychologically safe place can't improve. And so the opportunity to have feedback without fear of retaliation is great in a psychologically safe environment. Typically, feedback is received with openness and used to grow, not defend.
How many wonderful conversation candies you dropped in this intro round, and I will come collect on all of them. You just reminded me, this morning I was in a conversation with someone at work, and psychological safety popped up in our conversation, and it popped up through the lens of talking about what's the difference between confrontation and conflict, and how do these two show up in a psychologically safe environment, and how people oftentimes attribute confrontation directly into conflict, and that is not necessarily always the case. Now, when I saw the title of the panel, the word that most triggered my curiosity was redefining. And Ryan, you kind of asked for this, because I will ask you to tell us more about redefining psychological safety. Why do we need to redefine it? And please be our pioneer for this one. And then everybody, the unmuting competition is officially open. Just build your own chat.
Yeah, so for me, it's a little bit of coming back to the basics on psychological safety. When we look at it, somehow psychological safety's evolved in some employees' views of being everybody's nice, right? And truly psychological safety is the ability to voice those ideas, to share those thoughts, to have those confrontations with others and speak with your voice, and do it in a way where organizationally it's respected and seen as valuable. We have more generations in the workforce than we've ever had. And if you're not able to have this shared collaborative space for conversation on ideas, organizations aren't going to be able to thrive, because you do fall into silence. You fall into blame, silos, us against them. You're really able to find that perfect mix with psychological safety. It's a force multiplier for the organization from an engagement perspective and from productivity and everything else we're all shooting for.
So yeah, I think I agree with Ryan, about the need for redefining psychological safety, especially the part about being nice, right? So everyone, it's kind of a buzzword now. All the managers are like, yes, I want to build this, what can I do? They're not quite sure, but what they think it is being polite, not having difficult conversation because they want to create a safe space. They ask for people's opinions, but when you kind of like peel the layers away from that, what is true psychological safety but finding that comfort in the discomfort by having those difficult conversations and having the safety around those conversations that need to challenge ideas. You're owning up to mistakes, you're asking for help without embarrassment, without retaliation. And, I think that's where we really need to step one step deeper, just in terms of defining, okay, yes, we have perhaps that first layer of inclusivity, all of that stuff that we're doing, but where does the true psychological safety come in? And what we need to do is ask, what happens after they speak up? What are we doing with all of this information that we got? And that's really the next step of, I feel like, redefining psychological safety.
One of the things that really resonates for me in that is the mental health is really, especially workplace mental health, is a business imperative. And so HR can no longer treat psychological safety as a side issue. Redefining it to me means embedding it in policies, systems, and leadership practices so that employees can feel safe to seek support, so that they can admit when they're not okay and still be seen as competent. And true psychological safety can't really exist without addressing power and accountability. For me, HR has to go beyond encouraging just open dialogue, ensuring we have to ensure that there are safe reporting mechanisms, protection against retaliation, right? And visible consequences for toxic behavior, even at the top.
I love that, actually. And, piggybacking off of that, I think that I think the topic of psychological safety is interesting because I'm not sure that it has ever really been well understood. And I find that in the workplace, there tends to be a bit of a tension of, we want psychological safety. You can, we're a family, right? But at the same time, rewarding people who are perceived as high performers, even though they encourage or foster toxicity within their teams and within the organization. And both things cannot coexist, right? And so, and employees see that, right? And they're like, you're telling us that we're safe here, but what you're rewarding is the absolute opposite of that. And so I do think that's one of the reasons why redefining it is really important, because organizations need to know that it's a necessary competency for leadership now, right? It's not a nice to have. It's not something that we solve with just employee resource groups or with just one training program. It's something that you want to make sure that all levels of leadership, they understand and they're able to cultivate that within their teams. And cultivating that doesn't mean that you are, that there's a trade-off of excellence, right, and productivity. Those can coexist too. And in fact, when you do foster psychological safety within your organization, your teams, tend to perform better, right? And so really helping the organization understand that prioritizing that is in their best interest, but also they need to be prepared to help their leadership to align with that, and to be prepared to part ways with leadership that won't align with that, right? So that's one of the reasons why I think redefining it at this particular point is really important.
Such great points, Ngozi. I totally agree with that. I think on the, we're talking about redefining psychological safety from the actual definition of it. I think for me, we need to redefine it because often it's been kind of associated with mental health and wellness, which is cool. But then those things become an employer brand only type of situation. I think what tends to happen is the career site preaches, all of the great things. And then the moment that an employee gets into the company, from onboarding to everything in between, and then they look around, they're like, this is not a psychologically safe environment. I thought it was, and so psychological redefining it is so important. And it's so nuanced because, again, there's a generational piece of it. There's the different perceptions, right? So for me, psychological safety is a collective effort. It's a collective endeavor. It's not just on folks, the professionals like ourselves within this room. It has to be leadership, all the way down to directors, to managers, and then down to the team members. The dangerous thing about siloed psychological safety, which I've seen, is it becomes a sense of a coup, right? And so there's no psychological safety anywhere, but in pockets of the company, there are psychological safety. But what happens is, because it's so siloed, it becomes they versus them mentality. And then ultimately you kind of create a toxic environment. And so, just kind of adding to everyone's points here in terms of, doing more than just having the resources, doing more than just having, just saying it. You have to put actions into it. So it's very, very important.
I do want to recognize a bit of energy in the comments in the chat around the boundaries of psychological safety. And I love that point. So Dr. Angela Pearson, thank you very much for being my co-facilitator today. And I would love to take a few minutes to discuss just that. Now, you all raised the lens of generational nuances, but I was wondering, are there cultural nuances as well? I was thinking at my core team, there are 5 of us. We are 3 generations, but 5 totally different nationalities and cultures. And I would agree that while we overlap quite consistently on a core understanding, our comfort zones are not necessarily identical. So let's take a few minutes, and Janet, I will ask you to lead us into this slice of the conversation. What are the boundaries of psychological safety? This is not a check blanc for coming and saying whatever, whenever, however.
Button. You're absolutely right. I love that in terms of the opportunity. Psychological safety is definitely not the absence of accountability or professionalism. So creating that space within a framework of mutual respect, purpose, shared values. For me, the boundaries that matter are respect over recklessness, right? We don't want to speak harmfully. We want to speak honestly, but it's not a free, psychological safety is not a free pass to be rude, disruptive, or dismissive. Courage within context, I think, is important. So language, tone, timing are important, right? Especially for those difficult conversations or an opportunity to admit mistakes. How you do it matters. I found emotional expression versus emotional dumping, right? It's definitely not fine to say, write something negative in the workplace. It's okay to bring your full self, but not at the cost of others' psychological safety. So venting frustration can be valid, but targeting blame, aggression, or drama destabilizes teams, as we know. So the rules and framework for me around accountability is not optional. Performance expectations, feedback, consequences for misconduct, right? The too nice, I think, that Ryan talked about earlier in our introductions. Nice, yes, avoids conflict, but avoiding tough topics is not psychologically safe. It's avoidant.
Thank you. I saw a mention of also behavioral preferences in addition to generations and cultures as a lens of the conversation. So thank you, Kathy. Any other boundaries? What comes to mind?
For me, I agree with everything Janet shared, and the one added is, every organization has their unique values. that becomes a boundary as to how you act, how you behave, how you model those actions within an organization. And I think that's such an important thing to keep in mind when you're looking at, what kind of behaviors are acceptable versus not, generationally, behaviorally, everything. You need to keep shifting back to what are those organizational values? What is the organizational mission? How are you moving forward? How are those conversations supporting the greater whole versus just protecting yourself, for lack of a better term? Because generally with that lack of psychological safety, a lot of the response that I've always seen has been tied to some form of fear, whether it's fear of failure, fear of consequences, et cetera. Being able to focus on those values and that forward momentum is so huge.
I see a lot of supporting nodding on the screen. Linda, would you like to chime in?
Yes, so many valid points. I love these panels, I just have to say. Psychologically safe enough to say that. Yay. Definitely boundaries, right? I love what Janice said in terms of, okay, just because we're creating an environment in which people are not scared to kind of share feedback, it has to be feedback. It has to be constructive. It still has to have some sort of a collaborative effort to move forward. I do see kind of the common misperception of just, Janet, when you mentioned in terms of venting, right? Okay. For me, what I like to tell folks is, yes, give us feedback, but also give us recommendations, right? Recommendations on how we can improve. Psychologically safe environments, again, to Ryan's previous point, in terms of blame, right? Let's not blame. So for me, my general rule of thumb is, folks, we come here to work to go towards one goal, whatever that may be, with the expectation that everyone will remain professional. Workplace conduct does not go out the door just because psychologically safe environments are there. It's a part of the psychologically safe environment. But yeah, that's all of the good points have been made, and just kind of adding that to the points there.
Thank you. Priti and Ngozi, do you want to add anything to the boundaries? Priti.
Yeah, actually, I was gonna address the other question, Manola, that you brought up about the cultural differences and things like that, if I could, and it's absolutely valid, because having worked, in different parts of the world, different countries, a lot of people view, culturally different people view psychological safety very differently, right? And when you're heading or leading a very diverse set of cultures, it's very important to then understand the nuances of each country, each culture, each location. For example, Workplace Options did a really good survey last year, and across like 9 countries, something like that. So for example, a difference would have been, in Australia, the number one workplace concern was lack of recognition, whereas in India, it was conflict or tension at work with your manager. So it's so different that, psychological safety looks and feels incredibly different in all of these situations. So I think that's something that we all have to think about as HR practitioners, in terms of, it's not a one size fits all approach that you can really have to any of these solutions.
I love that. I want to revisit the conversation around boundaries, because I do think that's an important discussion. Psychological safety and organizational boundaries or whatnot, they're not mutually exclusive, and I think that's important to recognize that psychological safety as a topic sort of invites both the individual and the organization to the table, I think, to really understand what the goals of the organization are, what the values that the organization wants to embody, and then behaviors around that are the standard, right? things maybe that aren't so tied to that are up for are sort of fair game for reevaluation. And I'll give you an example of this, right? So some organizations, in the recent years have reevaluated certain things like their dress code, right? Because they realize that their dress code doesn't actually really advance their organizational goal. Like maybe it's just the same team, core people that see each other every day. They don't interface with customers, on a physical level day to day. And so they're sort of reevaluating and reimagining a dress code because they're realizing, well, does this really serve the purpose of the organization? Does it really confine and restrict people from their self-expression or, different ways that they need to dress for a variety of different reasons, religious reasons and cultural reasons or what have you, right? And so that's one of the ways that I've seen organizations really sort of reevaluate, the ways in which they hold boundaries, right? So there's like, we want to hold boundaries for the things that matter, but that means that there are some ways in which we as an organization can shift and change to support, the needs of employees. And so that's a piece of the conversation that I think is important. Really, the goals and the values, all of that is really core and important to make sure that we're rallying around and we're holding boundaries for, right? But there's certain things that really, I like to invite organizations to really think about whether or not there's room for flexibility for those things, and whether shifts or offering that flexibility supports employees in their sense of safety.
I totally love this conversation, and it's very frustrating and very painful to say that we are 8 minutes away from wrapping this up. And I was actually struggling with coming up with a meaningful, otherwise no pressure, last question for the panel. And as I was listening to what all of you just shared, I am left with curiosity regarding, is there such a thing as an HR flavor of psychological safety? Do we have to talk and nuance the conversation around psychological safety when we talk about HR practitioners and HR professionals? Because oftentimes we find ourselves in bridging conversations, in difficult conversations. And what would be your take on this HR flavor of psychological safety? I will give you a few seconds to think about it. I'm inviting everyone, just share whatever popped up in your mind when you heard the question, pop it in the chat. And just anticipating this question that we get quite often, this conversation is being recorded just like all the others, and you can go back and replay it or recommend it to friends and colleagues from LinkedIn or our Hacking HR lab.io platform. But let's go back, the HR flavor of psychological safety. And I would like to have Linda guiding us into this part.
Still stuck on the word flavor. I'm a foodie, so hey, I'm a little distracted. I love this question. HR flavor for psychological safety. I think it's not so much that it's a checklist that we all need to kind of check off and say, psychological safety. It's more so utilizing the definition of it and then communicating in a way that is truthful for you, right? Because if in this room as HR do not feel psychologically safe, then we cannot embody it, we cannot advocate for it, and it just won't happen. Team members will see straight through. And so you really have to find it within yourself to say, am I in a position to be the advocate for psychological safety? And if I'm not perhaps I need to find that person or do that internal back end leadership work before I become the face of it. And it just brings me back to my first initial point, which psychological safety is a collective endeavor, right? For everyone who's hosting all of the experiences from onboarding all the way to offboarding and everything thereafter. So yeah.
Who wants to jump in?
I'll let Janet. No, you can go, Janet. Thank you.
Okay, let's do Janet, Ryan, and then we will take it from there. So Janet.
I like the assigning because it's hard. I don't want to interrupt anyone. So thanks, Ryan, for letting me go. One of the things that triggers me earlier to what Gozi had said, I think for me, it boils down to assuming everyone is doing their best and building systems that honor that effort. And what that means for me in the flavor of HR is respect over recklessness, where we can ensure an HR policy becomes practice. So it's not just a buzzword, right? So clear anti-retaliation protections, safe reporting channels, transparent feedback and performance systems, and of course, equitable hiring. In the chat, I saw a lot of components and conversation about accountability and how our systems were built for folks who are minority potentially. So for me, psychological safety is the foundation for DEI. And I know that's not necessarily a safe word, but HR can create brave spaces where all identities are acknowledged, microaggressions and biases are addressed swiftly and skillfully. And HR helps develop and sets the tones for leadership, right? So holding leaders accountable to model psychological safety. And that a lot of that looks like emotional intelligence, active listening, accountability, and empathy, and conflict resolution without blame.
Thank you. Ryan.
Yeah, I'm going to 100% piggyback on what Janet said. You know, in HR, we excel at supporting and facilitating conversations. And, you know, with our knowledge, systems in place, the correct values, we can lean in with managers and or employees and help them create those avenues for those appropriate conversations, as well as how to move forward, and what's next piece of the puzzle to move this topic forward. Because as Linda said, it's a collective. It's a big, scary word that's being shifted in all kinds of different ways. And it's going to take a lot of effort, but HR can come in and play that role of the curious participator to help guide those conversations in the correct ways.
Thank you. Ngozi, and then we wrap it up with Preeti, how we started. Ngozi.
Yeah. So I love this. I love where we're ending with this conversation. I do struggle with the reality, though, that HR even today is often not a trusted resource, right? Not that it doesn't deserve trust, but there's a stigma, right, around HR departments everywhere. And it's important to really reconcile with that. And so I think knowing that there's the stigma and some people are just never going to, to reach out to HR, never really going to trust what HR says, for various reasons, even if, we are doing our best and we're working, there's still that stigma that often exists. And so I do think that that's where HR can work a little bit more strategically. Maybe there's conversations that need to happen head on. Great, we'll do that. But also I think thinking about creating the spaces within the organization, even if we're not there, right? Like what needs to happen, even if we're not there, to make sure that we are reinforcing in several different ways, not just one, but reinforcing and creating spaces where psychological safety can flourish for employees. And And sometimes it's not, a space where the CEO is, or a space where, HR, is in the room. Maybe it's finding a trusted external partner like the People's Talk space to come in and facilitate a safe space where employees can really process different things that happen. Maybe it's a restructure within the organization, and lots of people within the company left or something like that, and that's really having a toll on the folks who are still there. Create a space for that. Or if it's another unfortunate tragedy in society, create a space for that. And so I think that that's one way as HR we can really think a little bit strategically about how we are helping employees in the organization, even if it's not the best decision for us to be in that space.
Thank you. Pretty, bring us home.
Thank you, Minola. I agree with everyone. And it's a great question, Minola. I think for me, honestly, what I would say is HR's flavor is vulnerability. And why I say that is really because we are advocating something, but we're not the people who know all the answers. We take on so much on ourselves, for others, for the leaders, for the organization, and we have so much on our shoulders, but are we being truly, or are we feeling safe psychologically to, to make the mistakes, and have the organization tell us it's okay that you're making mistakes, and I think that's a really important part of HR feeling psychologically safe, and I think a lot of organizations don't really have that. So that's probably what I would leave everyone with as HR practitioners. Do you feel psychologically safe in your own organization?
Preeti, Ngozi, Ryan, Linda, and Janet, thank you so very much for taking the time and energy to be here and sharing your insights so generously and your thoughtfulness so generously too. Thank you, everybody in the audience. I hope you will stay on. We have the last conversation of today on workplace stress and burnout crisis coming up. And in the meantime, I wish that you can touch people around you with respect and grace and kindness. I will see all of you very soon, I hope. And until then, stay curious, not furious. Thank you, everyone. Hello, everyone. Welcome. If you just jumped on the link, welcome back. If you rejoined us after the previous conversations, we are wrapping up the first day of our Workplace Wellbeing and Mental Health Summit here at Hacking HR. And I cannot think of a more timely topic given everything that we have been navigating together over the past few months and quite frankly, few years. Now, my name is Minola Jacques. I will be your co-host for the next almost 1 hour. We have Jessa taking incredibly good care of us backstage. And we have an awesome lineup of speakers. And let's make the most out of our short time today. Jessa, please bring them on the stage. And this feels like sunshine. It's so wonderful to see all of you. At the risk of sounding like a broken record, I do encourage everybody in the audience to consider this conversation as much yours, audience, as it is our panelists. Whatever it is that we are tackling and discussing, drop your takes, your opinions, your questions, and please feel free to build your own conversation. I will try to keep the chat, an eye on the chat, and I will bring your points and your energy into the conversation. Now, let's make my blabathon end here and start in force. What I will do, I will pass the e-mic around clockwise as you appear on my screen. And the first question goes twofold. First, please kindly shortly introduce yourselves, and also do let us know what makes this topic so meaningful to you personally that you said, I'm going to be there and I'm going to share my time and energy and insights because this is important. Mary, it's so good to see you. Welcome.
Hello, to you again.
We can't hear you properly, Mary. It sounds like you're connecting from a submarine. It's okay if you do, but you need to rectify your audio. Let's try again.
Oh, can you hear me?
It's still the same. So let's go agile, not fragile. We will go to Brandy and then come back and wrap it up with you. Okay? Wonderful. Brandy, good to have you with us. Welcome.
Thanks, Minola, and hello to the rest of my panel and everyone else here. So my name is Brandy. I'm an IO psychologist and HR leader with over 15 years of experience in the talent management space. This topic is particularly near and dear to me, not just as an HR practitioner, but as someone who's helped organizations navigate change, grow through crisis, and rethink how we care for our people. I believe that building healthy organizations starts with asking better questions, not just are people performing, but are people well? And I'm excited to be here with this incredible group to share some insights and strategies on how we can move from burnout to balance.
Thank you. Nate, it's good to see you.
Hello, how are you?
Okay. Let's go Nate and then Nadine. And it's probably me not pronouncing the names clearly and correctly. It's afternoon here in Switzerland. I ran out of English. So Nate and Nadine, we go clockwise.
No, thank you, Minola. I really appreciate the opportunity to join today. Again, my name is Nate. I'm a HR Chief Personnel Officer out of Northern Colorado. I've been in HR for a little over 15 years. And I saw this topic come up and jumped at the opportunity to join on a panel because I see it in every industry, in burnout and mental health and the stigma around mental well-being in itself and how it affects us all just on a daily basis. And so I've really enjoyed the topic so far today and looking forward to today's panel.
Thank you. And Nadine, it is really great to have you with us.
Apologies about that. I'm actually on my phone because I also had connection issues. So I could barely see Nate's name and I thought I heard Nadine. So apologies, Nate. I jumped in. But I'm Nadine Levine. Nice to see everyone. I'm thrilled to be on this panel. I actually also come from over 20 years in a corporate background in HR or in various different roles within HR. But actually, I'm now doing some consulting work for a couple different small firms and my own company as well. And this is very near and dear to my heart because it's part of the reason that I left the corporate culture. I just could not find a culture where I was able to balance well-being and the things, the tactics that I heard around resilience and maybe even toxic resilience and ensuring you just push through. Those things just became too much. And I said, I'm gonna go do something different. So this topic is near and dear to my heart because I do want to help people get through some of the things that I experienced in the past. So excited to be here. Great to see all of you. Thank you.
Thank you. Frank, it's been a hot minute.
Yes, my friend, how are you? And hello, everyone looking in the comments and global audience dialing. Thank you all for taking the time. Yes, it's been well, and I hope you are well. Great to be here with you all. I'm Frank. I'm a self-prescribed people enthusiast, and I'll get back to that in just a second. But most importantly, I'm a father. I'm a husband. I've been spending now 2 decades in human resources around talent development, learning delivery, inclusive initiatives, and programming. But what really got me with this subject matter is I've spent a lot of my life's work, both personally, professionally, around worry and the baggage that we carry. And, with people and being a people enthusiast, and what creates this enthusiasm around us is, identifying what also may not make us enthusiastic and what kind of brings us down sometimes. So, here's one tool right away is great smiles around my fellow panelists and professionals here. We're getting through the technology issues and all that, and that is a great way to kind of help around, burnout and that early prevention. So happy to be here with you all.
Thank you. Mary, let's see if the gods of technology are using their powers for good today.
Can you hear me?
It's a little bit the same as before. Maybe let's try. If you try to read jump on the link.
I got you.
Thank you. Well, as I keep telling people, I won't be impressed by technology until I can download ice cream. Everything short of that, just not good enough. But let's not bring stress into the conversation this early on. But I would like to tie our panel with the previous conversation. And the first word in the previous panel title was redefining. So I would love to bring that lens now. And is there anything that makes the conversation around workplace stress and burnout different today than in the past? And you can choose a milestone in the past of your own relevance. So what makes this conversation different now than in the previous rounds when we talked about it? And for some reason, I always go diagonally. So this means, Nadine, that you will lead us into this round, and then everybody just jump in and build your own conversation.
Yeah, sure. Thank you. I think the thing that first comes to mind for me is the pace at which we work, right? And the expectations of always being online, always being responsive, the connectedness that there is, even globally, and those expectations to, oh, well, you have a work phone, you can respond right away. Maybe I shouldn't. So, I think it's the connectedness and the pace at which we work and the technology that enables that today that makes it so much different than in the past.
Yeah, you reminded me of, oh, I saw you available. No, you saw me online. There's a difference.
Right, exactly.
Yeah, I would agree with that sentiment, Nadine. Workplace stress and burnout are very different from the past in scale and source, right? So stress was often seen as temporary, tied to deadlines, workloads. Now it's much more chronic and systemic. driven by those blurred boundaries between work and life. I think, COVID didn't really help. That always on technology, the increasing complexity and roles that people hold. And then burnout isn't just about exhaustion anymore. It's more about feeling powerless and disconnected and unsupported, right? We're seeing also a shift in expectations because today's workforce, especially the younger generations, are more vocal about mental health and expect organizations to care holistically, not just about output. Right. So it's not just about resilience training or perks. We really have to rethink how we design work and lead teams and structure support.
A lot of supporting nodding and the Frank version of standing ovation there, Brandy. So Frank, would you like to jump in?
A lot of affirmations to what you all are saying, Nadine and Dr. Brandy. I mean, the always on and those kinds of things, we're constantly reminded, and Manola, you said it, the technology piece. I mean, I literally have a digital watch that reminds me to stand up and go for a walk and do this and always be in constant movement. I think the difference though too is just a systemic design. It's not just personal, it's a systemic organizational design that's different and that we may need to plan for in the future. Think about how your organization is literally structured, not how they preach that we're flat or there's no hierarchy here. Our doors are always, our virtual or real doors are always open. Literally, is the design of your organization really increasing and impacting collaboration and communication, right? The sense of community that you try to preach towards. Right. And that's something I think that's different from past to present. And what we need to plan for in the future is that these inputs and outputs are completely different. Therefore, that transformational design may need to be rethought as well as the systemic influence.
Nate, you got the hot seat of going last.
No, I mean, there's already been so many good points that have already been brought up and throughout the prior panels, as well as we talk about just the sheer number of the 5 current generations within our workforce and the differences between what the expectation of well-being and mental health really is throughout each generation as well, and taking a look at it from that aspect. And it's not just tied to specific things, but it's just the overall, we look at physical health, but also the mental health, in that we all are on different levels on different days. And it's okay to be vulnerable in those situations as well. And I think that's where that shift and that reclassification is really going to come into play organizationally. And we're always looking to make changes to better improve, but is it resulting unintentionally in that burnout and unnecessary stressors?
I was listening to your insights, and I was struggling to decide on my next question, because I felt that we should go a little bit deeper into what are some organizational and leadership unintentional triggers and things that feed into stress and burnout. But I kind of thought we've talked about that quite a lot over the past bit of time. But how about small, unintentional, everyday things that we do in our interactions that we don't even pay attention to, not because of thoughtlessness or not being mindful, but because we just don't think about it, or don't think about the fact that they might have unintended, profound consequences on the people that we interact with. So what are some of the small, unintentional triggers of workplace stress and burnout crisis? Like, I saw you available. No, you just saw me online. And I will let that question there, and please answer as inspiration strikes, something that you see around you. There's this wonderful quote from Muhammad Ali, from the boxer, that says that it's not the mountains ahead you need to climb that wear you out, it's the pebble in your shoe. So what are the pebbles in our shoes when it comes to our everyday interactions?
I'll go first. I think that's an important question, because a lot of workplace stress is caused unintentionally through those everyday behaviors and norms that we don't really question. So I would say, back-to-back meetings, for example, with no breaks in between in your calendar, that signals urgency and leaves no time to reset. In delayed or vague communication, which can sometimes create anxiety and force people to read between the lines. And I think also celebrating output and not effort or process, which can make employees feel like they're only as good as their last deliverable, right? And then we talked about it, sending emails or messages after hours. It creates that pressure to be on and available. And I think also maybe failing to acknowledge capacity, continuously adding tasks to an employee's plate without reprioritizing can quietly erode, motivation. So I think all those things, those small moments add up because they're baked into how we work and they often go unchecked. So.
Yeah, if I can, I'd like to piggyback on one of those, because I thought of it too, in terms of always celebrating the speed at which we work and the outcomes, as you mentioned, and not thinking about how that is probably not sustainable over time. And there's going to be times when you need to plan purposefully and strategically. But I think that often those that get the job done quickest, they get celebrated, and then that is expected. That's then the norm. That's expected. And the other one is related a little bit, in terms of stopping to reflect and actually, celebrate some small milestones, but also to reflect on, okay, what went well, what didn't go well, and to learn along the journey. And when you don't do that, you just continue to charge ahead, move the goalpost, keep going. It starts to become, it becomes a drain.
I think from an unintentional standpoint, and I've noticed it in myself throughout my career, but one of the things we unintentionally do as leaders is dismiss the concern. Hey, just hang in there. This is just temporary. We will get through this. So we unintentionally dismiss the concern by those responses, even though it was well intended. I think that burnout culture is really hidden from good intentions. We're shifting, and the biggest key is really shifting from the praising that sacrifice, as Brandy and Nadine had mentioned, and shifting to valuing sustainability and making sure that we are keeping that human element and that individual piece within our work as well, and continuing to really focus on that aspect.
So many important things. And I think, so I would use 2 G words here. One is a little bit of gaslighting, but unintentionally, whether it be by an external person doing it to you and changing your perception. And another G word, gap, an unintentional gap that's needed. And those words like dismissive and not taking the time, as has been said, I think, so we definitely gaslight both ourselves and others, sometimes unintentionally. Like, their experience and what they're saying doesn't align with me, because I really don't know. I don't truly have empathy and understand what you're going through as a parent, as a caregiver to someone else, someone with mental health. And because we're talking about early signs, I think the early sign is when it starts to shift our mindset. So when you literally are, you feel you're an adult, and yes, you're still always learning, but when it shifts your mindset into an ill effect, that's an early sign right there of like, whoa, this is not really adding to my growth. This is really shifting my mindset around things. And we need to take a moment to get back and, realign, or should I say reattune, because we're never really truly aligned with anything. We're attuned. And even with emotional intelligence, Daniel Goleman's, Primal Leadership book, he actually talks about attunement, more like a music sheet. We all have different instruments. We're all kind of trying to play the same, play a rhythm of music. We're not all aligned. So even that in itself is a mind shift, right? I'm aligned. We're aligned. We're all aligned. We're not aligned. We're attuned. And I think one of the prescriptive things in the early signs is something as easy as create an intentional gap between your meetings and your connections, right? Instead of the 30 minutes or the hour or the work session that lasts X amount of time, make it 25 minutes. If it's an hour, make it 45 minutes or 50 minutes. Not only does that allow for folks to get in, folks are always kind of running late from their prior one, but this momentum that you need just a moment to kind of be by yourself and shift your mood into the next meeting or shift your mood into the next connection, right? Because we don't know how your previous connection went. And I think those gaps are absolutely needed. And if you feel like it's really shifting your mindset, and then it's an early sign that stress is about to take place, and you need to kind of give yourself a little tune-up as needed, whether it be by music, getting some movement going, giving yourself a pep talk. I'm sure folks have heard about this, but I'll end here by saying there's kind of 3 people that you're dealing with: your I, the you, and then talking about yourself in the third person. And those are absolutely critical self-talk things that you can do. You can say, I am, something positive about yourself. I am. Be in the moment, right? Mindfulness. Mm-hmm. There's a second person. There's you giving yourself, this kind of a pep talk in the mirror, in a phone, just give yourself a pep talk. Like, you got this, be positive about it. You got this. And then maybe the third person, where you literally talk about yourself in the third person. And this is kind of giving yourself a gap between, this moment that you need, and giving yourself a bit of, self-talk that way in a third person. Yeah.
Wonderful point. And I was reading through the chats, and if we can go a little bit deeper and wider into these early warning signs, and really look at some of the things that we see, and maybe we easily dismiss. We still over-index on the grit and underplay grace when we talk about resilience, don't we? But also there are extra points available for early signs that are so subtle that it's really, sometimes it makes you question whether you're reading them right, or you're overthinking them, or overseeing them. So some early signs that we should really pay attention to. Let's see who practiced the unmute button.
I'll kick us off. I think one thing that I catch myself and you hear often is, well, I'm just tired today. And you're excusing that immediate moment, or I just can't think, or I've got writer's block. I just need to look over this communication 2 more times just to make sure it's perfect. And perfectionism and over polishing can be an early warning sign that we often overlook. That can be tied to burnout. And from that aspect, I guess, curious to see what the rest of the panel has.
Yeah, Nate, at first I was thinking, okay, what are the really subtle? I think that's a really good one. If I just say, oh, I'm tired today, or I start to get maybe a little bit cynical, start to really question the value of what I'm doing. So there's some other things that may or may not be, there's ebbs and flows, and you're going to have days that are like that. And it might not mean burnout, but it could be an early sign when you see some of those. So those are another few that came to mind.
Okay.
Thank you, Dr. Frank. I would agree with those. I think also, increased absenteeism and presenteeism, decline in work quality, productivity, the detachment. And and you already said this, the cynicism, especially in a team environment. But I also think, things like reduced participation in meetings. Someone who used to contribute ideas, now they're more passive and silent. Small delays in response time, someone taking longer to complete tasks. Avoidance of social interaction. Maybe someone who used to go to the team events isn't coming to the team events anymore. They always have something else going on. And even difficulty making simple decisions. I think when people start to feel unsure and overwhelmed, it's usually a sign that, there's just something else going on.
There's been so many D words that I was thinking about that you all have said so far. Let's type it up a couple of those notes, the depersonalization, the detachment, the imbalanced demands, and things like, I think I would add one more is just the diminished impact that you have. And yes, work is work. Some of it's transactional. We all have to, put together decks and get ready for, pitches and updates and, project things, and they're very transactional, but, we still get enthused about some of our work. And I think when we have diminished impact for ourselves or for others, that's a huge early sign right there of what's going on. Is it environment, organizational shift in priorities? Is it my own diminished impact? And really writing that down, typing it up, or having a conversation with someone and just saying, look, I don't really feel like I'm having an impact anymore, and have a conversation about that, for sure.
You inspired me to link impact with effective prevention strategies. And if there's one thing that came out quite clearly out of the conversations today, was that there is no such thing as a silver bullet or a one size fits all. So what can each of us here today in this conversation, what can we do to have our contribution into a small, meaningful impact in the life of people around us at the workplace? Is there anything that you have found works particularly well for you, or something that created a small spark of better for people around you in the workplace? Anything that we can all do starting right after this conversation?
Yeah, I'll mention one. Oh, go ahead.
No. I just wanted to tell people in the audience to drop their own ideas in the chat. But
sure,
we are all here.
Yeah, I think one thing that I've done often in the past, and sometimes I forget to do as frequently as I should, is just check in. And especially on people who seem as if they're okay, right? So they might just be masking what they're really feeling. And they're like, oh, it's okay, I'll get through it. Oh, I'm fine. Those are the people that you probably really do need to check in on and just say, how are you? How are you really? I think the other thing that I do pretty regularly and is a good habit is gratitude. Be genuinely grateful to people for their hard work, to your team members. And again, I get back to like celebrating successes, but gratitude is a big piece of it as well. So those would be two suggestions.
I think for me, sometimes getting inspiration outside of work. I'm reading the comments and I get it. Some folks are being very realistic and saying, look, the work has to get done and the pace and things are not going to change. Sometimes seek that prevention or inspiration outside of work. Don't expect that from work. How about that? That hasn't been said today. Go volunteer. For me personally, one of the things that brings me absolute excitement and joy is something that I volunteer with at my son's school called All Pro Dads. It's a way for dads to get involved, and we have conversations around courage, empathy, resiliency, but we have a little bit of food, a little bit of music, a little bit of fun, and it gets my day going really early in the morning. That by the time my very first meeting is turned on, folks are like, wow, you had your cup of coffee. I was like, I haven't even had coffee yet. But I have my cup full literally of enthusiasm. I've got a little extra. I can pour it into your cup if needed. And I won't literally say that, but I get that. Maybe that is a tip for the audience right there too, is don't always lean on work and the work programs that are available. Seek that preventive action outside of work. You know what it is that fills your cup. Do it, and do it consistently.
I love that. I love that. And I'd add, seek connection outside of work, right? So it's not just, I love that you found an activity, and some people will, but sometimes it's just connection from people that aren't necessarily within your workplace, that you really can lean on, that you can listen to. Oh yeah, absolutely.
Yeah, I love what everyone is sharing. I think also two things that have been particularly helpful for me and my team is putting in some recovery time or moments, right? So either building that into your own calendar and not making your calendar like a Tetris game, or incorporating that time when you have meetings. And the first 5 minutes of a meeting is just kind of like a reset and asking everyone how they are and how their day is going, right? And then the other thing that I've done is, instead of having, performance reviews or performance conversations, we've really started to have more of like capacity conversations, right? And, we talk about workload and energy and support needs. That's really been a game changer.
Everyone's hit on such good topics, reiterating kind of Frank's statement, as leaders and within HR, all too often we are so focused on caring for others that we forget the self-care. So finding our purpose, as Frank said, getting out and volunteering. It was a big changer for me, volunteering and getting involved in a nonprofit in our community and being able to find purpose outside of HR, if you will, or outside of being that identified leader, something that you can connect with, that you can vent to and focus outside and reset and disconnect from what you do on a day-to-day grind, just to allow yourself to come back refreshed.
Love this conversation, and we're about 6 minutes away from wrapping this up, but I would love to leave on the table two things that came to my mind as I was listening to your recent share. One, do look up the 7 types of rest, because it's not just about a longer weekend, Netflixing, or going on a hike. We also need emotional rest. We need mental rest, creative rest, social rest, which many people say, oh yeah, me time. No, social rest is having 1 or 2 meaningful connections where you show up with no mask and you show up fully authentically, and you put no energy into any kind of screensavers or filters, and spiritual rest that some of us find in our faith, some of us find in our volunteering work, but just connecting with something bigger and deeper than our everyday existence. And another thing, and this was a big aha moment a few years back. I was helping out a friend of mine with a career coaching client onboarding questionnaire. And boring, and then 2 questions, one after another. What were you taught about work growing up? And what have you come to believe about work where you are now in your life? And I do believe that if we take a bit of time to look back at, what purpose does work serve in our life? And therefore, how much space and focus and energy and impact we allow it to have on our well-being, mental health, quality of life overall, that might trigger some incredible self-reflections and might make us aware of some pebbles in our shoes that were, things that we absorbed from family and friends and our immediate environment that are not necessarily our own. But I would like to make the most out of the last 4 minutes. So this is the wrap up punchline mic drop round. Otherwise, no pressure, no stress. So we will go counterclockwise. So we will start with Frank and with Brandy.
Well, first, I want to give affirmations to so many folks in the chat: Pago, Annabelle, Suzette, Ashley, Suzanne, William. So many folks on there giving each other advice and modeling for each other. So thank you all for that. I see you all, definitely. And apologies for those that I have not called out. There's so many of you all. I would leave this almost just from an assessment piece. So there's, you talked about the 7 types of rest. So I'm going to take away from that. But I think two assessments that you can do on your own and find a free version of it. One is areas of work life. It's a survey you can find online where you can take a look at your own workload, controls, reward, community, fairness, and your own personal values that you have. And as those decrease, obviously, then your stress is increasing. So it's a great indicator. And of course, the old tried and true that's been around cross industry is the Maslow burnout inventory, which actually can measure depersonalization, emotional exhaustion, and personal accomplishment or lack thereof. And you can find free versions of those. Do those privately. Don't wait on the surveys that we do in the work. Take some time to do those quick assessments, find out where your stressors are, and then talk and connect, as Nadine talked about, connect with others.
Thank you. Nadine.
Thank you. So I saw the chat too briefly. I'm trying to follow along, and there are some amazing call outs. One in there actually had me thinking about modeling the vulnerability, modeling all these behaviors as a leader, being vulnerable as a leader. So all the things that we're talking about, if you are feeling them, if you are facing them, you've got to show that as well. You've got to tell your team, hey, I'm struggling today. Hey, I think that not only builds trust with your team, it humanizes your leadership, but it's so important and allows them, if they're feeling any burnout, to feel a little bit more, open to sharing. So please model these behaviors and be more vulnerable with your teams. And that would be my biggest call to action or takeaway from today. It's so critical to make sure that your teams know they can count on you.
Thank you. Nate.
No, Nate, I think that's a great point. What I always think about is going back and thinking, how can I flip my funnel? I mean, every day we have ideas coming in at a rapid pace, but how can I trickle that out at a more focused and strategic route? And instead of trying to accomplish 5 things in a day, what 2 things can I accomplish from a personal performance standpoint? But then how can I help the team? And what's 1 or 2 ways that I can and do that? And I think all too often I see folks in our teams, well, it's okay, I'll just work through lunch. No, that will be there when you get back from your lunch. Take that lunch, go for a walk, take the opportunity to reset and come back with a fresh set of eyes.
Thank you. Brandy.
Well, I think, first we have to stop glorifying exhaustion and start valuing sustainability, right? Healthy teams do great work, yes, but they also last, right? And so as leaders, as HR practitioners, we have to stop asking how can we get more out of people and say, how do we take better care of the people that we're counting on? That's what's going to build workplaces that are worth staying in. And, I think also burnout isn't a personal failure, right? So if you are feeling burnt out, don't think that you are personally failing. It's a signal that the system needs to change, right? And And the real work isn't just helping people cope, it's creating those conditions where they don't have to. And so I would just keep that in mind.
Thank you all so very much. I will just leave you with an incredible piece of wisdom courtesy of Instagram, that stress spelled backwards is desserts. So on this positive note, self-care can be a wonderful cake for mind and heart and soul. And please stay on. You have an amazing last conversation of the day. And I do hope I will get to see you soon and welcome you wonderful people on my screen again. Thank you. It was absolutely wonderful.
Hello, everyone. Greetings. Welcome to Hacking HR's panel, The Leadership Role in Mental Health, How Managers and Executives Can Actively Support Employee Well-Being. Welcome, everyone. Thanks for being here. My name is Danielle LePage. I'm Hacking HR's Chief Learning Officer, and I'm dialing in today from Playa del Carmen in Mexico. I'm excited for the discussion at hand. We have a critical topic to dive in today for the next 45 minutes. So let's jump in, shall we? Jessa, would you kindly bring our panelists to the stage? Hello, hello. Greetings, everybody.
Hello.
How are you doing today?
Great.
Doing great.
Wonderful. I think we should go around the table and introduce who we are, what we do, and why we're here today. Julie, do we want to start with you?
Sure, great. My name is Julie Masagia. I'm the Chief People Officer at CMI Media Group and Compass, two healthcare advertising companies. I'm here today because I love this topic. It's great to hear the role of accountability that leadership plays in protecting everyone's mental health.
Absolutely. And is it Cindy?
Hi,
Over to you.
yes, hi. My name is Sandy. I am the HR manager for a aerospace and defense company, and I've been doing HR for over 20 years. And this topic is super important to me, just not as a work, not just in the workplace, but also in our personal lives.
Thank you. Thank you for being here. And Natalie?
Yeah, hi everyone. I'm Natalie Morgan. I'm the Senior Director of People at CareerPlug, which is a hiring and retention software company for small businesses. Like others said, this topic is incredibly important as far as our responsibility and the accountability we can take as leaders, and also personally as someone who has their own mental health journey and is trying to lead with that journey in mind and take care of our employees. I'm really excited for this discussion.
Thanks for being here, Natalie. And Petronila, did I say it correctly?
Yes, you did. Hello.
Hi.
Hello, everyone. Very excited to be here, and thank you very much for this lovely opportunity. I am Petronila, as I've said, and I head learning and development at Saraba Hotels in Kenya. Very, very happy to be here and very passionate about people and well-being.
Thank you very much. And Dr. Wahida, did I say it
Waj-
correctly?
It's Wajida.
Wajida. Awesome. Go ahead.
Hi, I am Wajida Small. I am the Chief Human Resources Officer for Trinity Church NYC, which is a religious institution in New York City. I've been in HR for over 20 years, and this particular topic is very personal for me. So I am very excited to have this conversation with you all.
Thank you all for the lovely introductions. We're a lucky group today to hear from all of you. So we're going to dive into just a question to get us kicked off. And this question is for everybody. All right. So why is leadership's involvement in mental health not just helpful, but a necessity in today's workplace?
I can kick us off. So why I think that it's a necessity and not just helpful is because when we lead by example, we set the tone for the culture that we create and what's important in that culture. And therefore, it is a necessity to have the humanity of our leadership show and be involved and reinforce the messaging and the values of the organization related to employees' well-being and mental health.
Yeah, you said it beautifully, Julie. I think like setting the tone is the first thing that came to mind for me, right? As leaders, you're setting the vision, you're setting the goals, you're asking a lot from people, right? As we're all hopefully swimming in the same direction, trying to accomplish whatever
Yeah.
organization is trying to accomplish. So people's health and well-being, their mental health is part of that, and you really ignore that at your own peril, right, as a leader, but it is also part of if you're going to come at it from a very like business minded point of view of like we want to get the most out of people, you get the most out of people by taking care of them and by creating a safe environment, by allowing them to do their best work, and that means taking care of their mental well-being.
I definitely agree with that. And what comes to mind is the saying, be the change that you want to see. So if you want a healthy, engaged, involved workforce, you too have to be healthy, engaged, and involved. And that starts with your overall well-being and your ability to be fully present to do the work and support those that are also doing the work.
You've actually taken the words out of my mouth, Dr. Vajita. be the change you want to be, yes. And as the leaders in the organization, they drive change, they drive everything. They're the ship steers, they're the captains and the pilots of all the organizations that they are in. So for me, well-being is really key, and it has to be driven from this other side of leadership, because then it's the leaders that drive the strategy, the leaders that drive any change that's in the organization, but it's the humans who have to do the work in the organization anyway. So what does that mean? It means that if they're in a beautiful organization, if they are happy all round, physically, mentally, socially, psychologically, financially, then they will thrive and the businesses will thrive, and there'll be no one having headaches of all performance and all that stuff. So leaders must be there to drive the ship and steer it. That way, well-being actually becomes the one thing that makes organization A and B different, and it becomes a strategic differentiator, across the organizations.
I love it all. Great responses, everybody. I have some questions, some personalized questions for some of you. I'm just going to jump into it here. Natalie, how do you personally model self-compassion or set boundaries around your own well-being as a leader?
Yeah, thank you for that. And I think it builds on what that we're saying here, right, as far as leading by example. So it's something I try to think about, right? Like if I'm burned out and falling apart, I'm not really encouraging anyone else at the company to take care of themselves if I'm showing up in that way. And for me, that, if you're working wild hours, or I'm getting resentful, or I'm not getting sleep, and that's like showing in whatever, meetings or showing up in, it's just a mess, right? So by setting boundaries of, practical things like my working hours and not messaging my team after hours, or scheduling messages if I need to do that, prioritizing movement. We've started at our company, a lot of us got walking desks, or like walking pads, and that's just become part of our culture. A lot of us break out our walking pads, but for me, that's a really important thing for my mental health, of having a little bit of movement during the day. And then I also think modeling that vulnerability of when I have had tough times at work, and vulnerability with boundaries still, right? Not oversharing or not kind of putting everything on other people. But I've been pretty open about, here's when I've struggled with depression, or here's when I've had a tough thing happen in my life. And thank you, team, for supporting me through this. Here's what I need right now. And that in turn has given, at least my reports, and I've seen it throughout the company, permission, right, to like let life be life, and let it come to work, and let people support one another.
Does anyone have any thoughts, what Natalie said, that they'd like to share before we move on?
Yeah, I could add that self-care is really important in all this, and just having your boundaries cut clear is very important. So I was going home yesterday, I was listening to a podcast, and in this podcast, the lady I was listening to said that sometimes organizations have this thing of, yes, you're on leave, but then you still have, and you have your out of office on, but you can't resist checking your emails. What does that mean to you as a person who's working? Are you really separating work and life? I know they are all integrated, but how are you managing your self-care yourself, even as you're on leave, So good points.
Really good points. Julie, this one's for you. What programs have you put in place in your organizations to support employee well-being?
So we actually have employee community groups that are designed to support employee well-being. One particular employee community group that focuses in this area is called Thrive, and they are empowered with budget and people and learning resources from the organization to put out programming for our individuals in the organization that's meaningful to them to support their mental health and overall well-being. It also provides a community of support for them as well, so that they have that safe space to be able to speak with others and get the support they need. In addition to that, there's traditional benefits programs, but there's more robust offerings. We're proud to partner with an organization called Rethink that works with neurodivergent individuals who have behavioral and learning needs, and it also provides support for managers as well on how to support those employees. In addition to that, we've provided training for our managers on empathy as well as a feedback model. And I know that this isn't super connected to well-being when you think about it, from just the mental health space, but it actually does connect quite nicely. We all go to work because we all want to do a great job. Nobody's going in thinking, I don't want to do a great job that day. But in order for us to grow, we need to be able to give feedback. So we use a feedback model and a way to receive feedback that gives objectivity to how that's done. So it empowers a more positive conversation and doesn't have employees walking away feeling defeated. It's been so well received and something that I think contributes greatly to employee well-being.
Oh, that's fantastic. Love to learn more about that. Does anyone have any other ideas or programs that you've put in place in your organizations that you would like to share with the community today?
One of them is
Sure.
the
Go ahead, Sandy.
Okay, sorry. So one of the apps, Calm, I know they have like a free version, right? But we went ahead and we upgraded it to for them to be able to use it for those that choose to actually use the app. So I think it's also been beneficial for them as part of a benefit,
Does anyone have any other programs they want to elaborate on a bit?
Sure, I'll share ours. We actually call it Trinity Well Street, and it is a wellness program that focuses on the 8 dimensions of wellness. And so when you think about well-being in the workplace, providing our staff with all of the tools that help them develop and be well in all of those areas.
That's great. Thank you for sharing. All right.
We
I've got it.
have,
Oh, go ahead, Petronella.
okay.
Go ahead.
We have, in addition to all the beautiful things I've had shared, we have an employee assistance program to take care of mental wellness. And so far, it's really helping all the employees. And the cost of mental wellness, it can be really expensive. So having the employees have a facility that they can always go to when they have any problem is a plus. In addition to mental wellness, we have facilities for games in our units because as I said earlier, I work for a hotel and lodges and a resort. We have facilities to take care. We have sports activities and people can go and release all the steam after a long day's work. We also do a lot of awareness around financial well-being because, as they say, your career, if you thrive at your work, then you're thriving everywhere else, So financial well-being can be really a big thing to people if they can't just have knowledge of how to manage themselves and their finances. So we have wellness sessions for finance. We have employee wellness sessions for general health, just take care of your health to monitor how you're doing. And if there's anything that have been identified medically, then you can escalate further. Just for a few.
Fantastic.
Yeah, and I'll jump into. I'm taking like some notes because this is some fantastic ideas here. And Julie, I was writing down that employee community group like Thrive because we have employee resource groups, but not one particularly for kind of mental wellness. So I'm going to take that to my team. So thank you for that. I wanted to double down on one that like manager enablement. That's something we've tried to do a lot at my work as far as training on psychological safety, training them on the benefits program. So if we have an EAP, we have some, traditional benefit package, mental health resources, and making sure managers are really aware so they can provide that in the moment to employees has actually been a big push in the last 6 months or so of how can we train them up more on how to provide those resources. And then as part of our leadership development, we do a lot of training on psychological safety and emotional intelligence. I was just leading a book club this morning on Dr. Brene Brown's book, Dare to Lead, and talking about that importance of vulnerability and how that can show up and create these safe spaces for mental health. So I was just having a mental health discussion with some upcoming leaders. So yeah, I think there's a lot you can do, and it's just fun to see all these programs. I would just add the communicating part of it, and really, I have found I really need to over communicate the benefits and programs in place. Otherwise, they get lost.
Right. Right. No, that's all fantastic. And for those of you that are dialed in today listening, if you want to throw in the comments box some of the programs that exist in your organization today that are proving to work, please add them so everybody can benefit and take note. So I appreciate it all. Petronella, I have a question for you. They say numbers speak louder than words. So what's the ROI on investing in employee well-being?
Wow, thank you. Employee well-being is big, yeah, and a happy employee is a happy workplace. That's for sure. So if you have proper well-being strategies, then you're having a happy environment. So what do I mean? You start to kill all these isms, absenteeism, presenteeism, and having people just coming to work for the sake of coming to work. I mean, I could talk the whole day about just this bit of the ROI of it. And over and above even the ROI of it, having proper, or rather having good well-being initiatives at work, the employer, so the leaders, can always look at the value that comes from the well-being initiatives that they have. So that is talking on the value of the investment over and above the ROI of the investment on employee programs. High productivity is a given. Great performance is a given. Low turnover is a given. And yeah, pretty much just a few that I can mention that quickly come to my head on the importance of investing, on the ROI of well-being initiatives. And as I say again, from the eyes of HR, what gives HR sleepless nights? People not applying for jobs when they have sent posts. So having good well-being initiatives then makes the organization a talent magnet. So people apply for jobs, then no sleepless nights are experienced by the HR team, and that gives the company as well a high net promoter score and high productivity. Yeah.
Anyone have any other thoughts or insights on the return on investment on employee well-being? All right, this question is for Cindy. As an HR director, you're often the bridge between policy and people. What have you found most effective when translating well-being initiatives into meaningful employee experiences?
I think what's really helped and been beneficial is being transparent, and also, which has been discussed before in this panel, where we kind of model, right, that behavior. We kind of model, or we explain the reason whys, right? Or we also make ourselves relatable. And I think being relatable goes so far, especially with something like this. I think it's still very tabooed, the topic in a lot of the workplaces, depending on the type of environment, the type of company that you have. And so I think it's not a one size fits all. You have to kind of cater it. And aside from the catering it, I think it's not just to the company, but to the individual, right? If I know, let's say, for example, employee A is super shy about this topic, doesn't receive the topics well, right? I'm not gonna sit here and try to like share it in front of everybody with him, right? Or her. I'm gonna actually get him on the side and be like, hey, did you know we have this? We're looking to do XYZ. Do you have any questions? Why? Because the more you cater it to that individual, the more you know your audience, the easier it is for them to accept it, whatever it is that you're trying to implement. But again, relatability and sharing your own experiences, your own struggles that you've gone through, I think goes a long, long way when it comes down to being able to be that bridge, and being able to find that gap. And again, it's understanding that maybe perhaps the whole program's not going to fit for absolutely everybody, right? Especially our older generation, right? They tend to be like, oh, me go to a therapist? What do you mean? That's an insult, right? And so just knowing how to approach the topic, and understanding those different generations and what they're willing to do, what they're not willing to do, how they like their information, or just being able to understand and being able to find a program or create a program that maybe they're not going to touch the 20 things that you are offering, but that I at least will touch 2-3 of those items. It's super key and beneficial.
Yeah, one size doesn't fit all. And as the leader, we're giving the green light to our team members that it's okay. It's safe to open up to your team or to your manager. It's green light. So if I open up with my team, it allows them to maybe just start to test the waters a little bit to see if it's okay. So absolutely. Anyone have any more thoughts about that? Bridging between policy and people.
I think it's about time leaders change their mindset towards mindsets. Yes, mindset, toolset, skill set, mindset on how we package well-being at the workplace and how we even package the benefits across. And I like what she said, what Sandy said on the different categories of the workplace. Like you have close to 5 generations in the workplace now. So if you're going to come up with archaic, old school benefits for a 17-year-old, 18-year-old, or 20-year-old doesn't really care about a pension, I think you're not doing justice to the workforce that we have. So it's about listening well to the employees, listening to them to know what do they want, and that is from the pulse surveys that we have. What would make them feel happy at work and then engaged at work, to be more productive, and for the organization to have more retention. What would make a big difference to a 30-year-old or a 50-year-old in the workplace? If you have this young person who's being given a maternity cover, I mean, at 20, I don't think about that. At 35, I am all about that. At 50, I'm all about something else. So it's about packaging these things differently to help different employees have meaning and purpose at work. Yeah.
Absolutely.
Julie.
Oh,
Can I add
go
something
ahead.
really quickly? Oh.
Yes, please.
I was going to say, I think part of bridging the gap too is allowing employees to have a voice and tell you what it is that they need, as opposed to making assumptions about what you think is best. I think it's easy for us as leaders to just say, here's what we think should happen, without really taking
Did we lose the voice? What she does
Oh,
voice.
I'm sorry.
There you are. You're back. You might want to back up a little bit and rephrase it, because we lost, I think, the last half.
Okay, sorry. The gist is employees should have a voice. We should listen to them and understand what it is that they need when we are thinking about the policies that are going to impact their well-being.
Absolutely. If they're a part of the decision making in the beginning, they'll be more bought in and engaged and bring others to the party as well. Oh, that's a really good point. We just can't assume that, the 20 somethings in our business need this and the 30-year-old something needs this. Yeah, we absolutely have to ask. Great thought. Julie, I have another question for you. As a CPO, how do you ensure mental health isn't siloed under benefits, but becomes part of a business strategy and leadership behavior?
So I think the most important thing there is that it needs to live within your values and the mission of your organization, that you care about humans and the whole self that they bring, and that you recognize that in order for you to be successful as a business, living those values and protecting and supporting the people that you have within the organization are able to do their best work. And they cannot do that if they are only being seen as workers and not as humans. And so I do feel very lucky, and I can never say this enough, that I have CEOs that support this, understand this, and believe in this at their core. And it's just first nature of who they are. I know sometimes as HR professionals, we walk into leadership teams that need to be educated on why that's important. So I don't want to skip over that fact. I do feel very lucky that I have that alignment up front. As HR professionals, so many people are in the job market right now, ask those types of questions about the organization you're joining when you meet with the leadership of the team, and try and understand what leadership behaviors you're looking for that actually support those values, and then hold leaders accountable to them. We think about empathy as a leadership behavior. We think about development as a leadership behavior. We think about seeing the whole human as a leadership behavior. And those are things that actually live in our performance review systems and our peer recognition systems. So they are not just this nice to do thing. They actually are critical to how we are measuring the success of our leadership as well. So that is how we're able to have that accountability in terms of the leadership behavior that we expect to see as well.
Yeah, I love that, Julie. If I could build a little bit, because you talking about values really resonated with me too. Because I mean, at the heart of this, right, we can put all the benefits out there in the world, but if your organizational behaviors and systems don't ultimately reward and supporting mental health, then your employees aren't going to feel supported either. One of our core values at CareerPlug is be kind, and one way we train on that, introduce people to it, train managers, is like be kind includes being kind to yourself, and this like self-compassion and encouraging people to ask for what they need and setting boundaries. We've done lunch and learn specifically on boundary setting in the workplace to try to give people those tools. And I love those questions you said for like people job seeking or the teams you're part of. And it just comes back to, I think there needs to be like true buy-in at the executive level of this is how we're talking about mental health. This is how we're supporting mental health, getting that, hey, I'm taking a mental health day, like integrated into the language of your company, if not in your policies itself, is really important from a leadership level. Because you can say, oh, yeah, you can take mental health days, but if you never see leadership doing it, if you never see them saying that word or asking about it, that's not permission or acceptance to do it. If you have your executives only giving shout out and recognition or promoting people who are clearly burnt out, and they're like, oh yeah, thanks for sending that to me at midnight, right? And they're saying that in front of the company, that is recognizing behaviors that are antithetical to what you actually want to happen. So getting that like executive buy-in of like, here's what this means, here's we're going to support it, and having some universal language and agreement around that is really important for the culture to actually shift and support employees.
Love that. This just gets me thinking. And I'm thinking about asking everybody like in the community that's listening in today, let's say you're having a challenge getting buy-in from leadership on investing in an EAP or another platform or program that costs. What are actionable takeaways? What are great little ideas that a company can put in place today actionable takeaways that they can put in place today to increase engagement when it comes to our mental health. I just would love to see a bunch of ideas coming in through the comments, little things we can do to help our employees and their well-being at work. I'll just put that out there. So the next set of questions I have are some core questions for anyone to jump in and respond to. All right. The first one is, how can managers practically support well-being during high pressure periods without sacrificing outcomes?
Listen to understand. I think just sometimes creating the space to be there to listen to what is going on for the employee. They don't always need an action. Sometimes they just need that space to feel heard. And that's so simple and easy to give.
Right. And that could prevent some more serious feelings or later on in the day, just because you asked how that person was and they were able to get whatever they had off their chest, and they actually could move on through the day.
Nice one, Julie. And also just have this thing of awareness is really key. Awareness is very important, even for me as a person. Know well-being issues, understand them, and every leader should know that well-being is not a nice to have. It's a must-have for organizations, for the team to thrive. So self-awareness and awareness generally of all these well-being issues, and know the triggers even, so that you can deal with issues as they come up and you can identify them earlier. So a lot of times I think leaders deal with things on symptoms stage, as opposed to having proper digging in of issues to just know that what could have caused this, what could have really caused this. So we should have that as well, in terms of just knowing what is this, what is it showing, what is this person indicating, like being a doctor and not being a doctor. Yeah.
How often do you make mental health and well-being a part of your regular conversations with your teams?
I can share that we have one-on-one templates for our managers to use that helps them structure their meetings without needing to think too much about it, because people's days get really, really busy. So that's been one thing that's been really practical and helpful for our managers, to ensure that it's a regular part of that one-on-one conversation. So you have the time to focus on the projects, you have the time to focus on the development, and then you have the time to focus on the human.
Something that we do as an executive team, which I think is a easy, practical way to check in on each other, and it's kind of a lot of our teams now do this, but as part of the start of our meetings, we do a weather pattern, and there's lots of different versions of this exercise, but we go around, we share something good and personal and business, and then we give our weather pattern. So someone might be like, oh yeah, it's sunny outside. I'm feeling sunny today. And then I've had peers who be like, I'm in a hurricane, and then they'll be like in a hurricane for weeks, but it gives us that in to be like, what's going on? How can we help you? Is this work or personal? And it's usually a blend, but it gives this opening in the conversation for us to check in on each other as humans, and then have that context going into what our 2-hour weekly executive meetings. We understand where our energy level is, where we're coming from. And I think that model at the leadership level has helped other teams model a similar check-in throughout the company.
That makes total sense. And if you're starting at the leadership group and everybody is benefiting and engaged, they are going to pass that down, like the ripple effect. So that makes total sense. Does anyone have any other insight into how often you're having these types of combos with the teams?
I tend to do them when, like, if I just see, like, if I just pretty much any interaction that I have, like with a manager, supervisor, executive. Hey, how are you doing? And then they're like, oh, I'm fine. No, 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 that's not what I asked. Like, how are you really doing? I heard, such and such things are going on in your department. How are you handling that? Like, anything we can do to help, alleviate some of that stress. So I try to, like, I see him, come here. I know something's going on in your area. Let me try to, as well as the one-on-ones. But I try to do that as soon as I see them and I know something big is going on in their department.
Maybe I'd flip your question a bit and just add that while a lot of times leaders would ask the team members, how are you? They're always in a rush. They're always in a rush and running. So Sandy actually just put it rightly. It's important to just ask, how are you? And look the person in the eye and observe the body language. Because most often than not, you are asking the question, how are you, for the sake of asking, but not asking how are you for proper conversations, for identifying issues in time. So here, training can even come in to just teach people small things on how to have these conversations. How are you? Look me in the eye and let's talk. Let's move on after that. Yeah.
I was just thinking of it from
If I could just add something
yeah, go
really
ahead.
quickly. Yes, we do the one-on-ones. I do the one-on-ones with my team, and I personally check in. How are you? How's everything going? But what I really value is in our executive leadership meetings. In every meeting that we meet bi-weekly. Our CEO does a check-in with all of his executive staff. How are you doing? How's everything going? What kind of support can I provide to you? What do you need? And for me, that is extremely valuable. And to me, that is leading by example. So
I agree. I think a little goes a long way. We have a few moments left, so I just want to do another roundtable with a closing question. All right, ladies, what's something you wish someone had told you earlier on in your leadership journey about mental health at work?
I'll start with do great work, but also ask for what you need. When you're doing great work, people are going to want to give you what you need to support that great work. So if you're not asking for it, people won't know you need it. So don't be afraid to advocate. The worst that somebody can tell you is no, and at least then you'll know where you stand.
I should have gone first. You took my words, Julie. That's the first thing that came to me was like, ask for what you need, right? And to be more open. I've been fortunate to have leaders I felt very safe with in my career, and I wish I had been open earlier with my needs or when I was struggling instead of trying to push through or letting things escalate too much and then I needed to take a week off or something because I got burned out or whatever the case may be. So thinking about what I needed so I could model that better for my team and other employees too. So thank you, Julie. You said it better than I did.
I would add in and say
that is.
I go on, Doctor. I would add in and say.
Oh, sorry. Yes, I was going to say part of that is checking in with yourself so that you know what you need. One thing that I have found is we don't hide our stress as well as we think we do. So if we actively check in with ourselves, am I okay? What has been happening? What is it that I need? We'll be proactive in seeking that support.
It's okay not to be okay. That's a writer that goes on all the time. And rest is key. Rest is key. Sometimes leaders don't take rest. Leaders assume that they are, for lack of a better word, and with all due respect, robots, and they can go on and on and on. And most of the time, you'll fall down. So rest is key across the spectrum. And for that, like I'd like to leave the leaders with just one quick framework of model the way. And model here is an acronym that would be anytime you're doing a leadership initiative, and not a leadership, excuse me, what, not a leadership initiative, but a well-being initiative, then model the way, show the business the why, the beauty in having this initiative. So M, model the way, outline the program on how it's going to be. Is it a good thing? Is it a good initiative? What's the value of it to the business and to the teams that you have? And then D is demonstrates, demonstrates and do the thing you want to see people doing. So lead by example, E was embed this in culture, have everything going on in your culture. What do you want to see? How do you want to live it? Have it going on in your culture. And listening is very key. Listen to your employees, and that takes us to ask those questions that will make you have a proper well-being structure in the organization. Thank you.
Thank you, Petronilla, and thank you to everyone today for having a great discussion. Thank you to our community for tuning in. This has been our Workplace Wellbeing and Mental Health Summit. More coming tomorrow for you to tune into. And we're going to say goodbye. So have a great rest of your day, folks. Thank you all so much. Appreciate you.